going to switch out to yellow if I can't. Is it working? We good? Hello. All right, I'll stick with yellow for the moment, and then while you figure out brown. And then I think Miss Ceci in the back had her hand raised as well. Thank you guys for volunteering, but I'm going to probably take one more because all my three were on this side, and I need somebody from this side so we can feel balanced. All right, so we'll get to you in 1 second. All right.
I wasn't here last night, but I did watch online, and I was shocked to see that isolation actually increases your risk for heart disease and stroke. I think it was like 30% or something like that. So that was really shocking.
And see, all this time you thought it was your coworkers that were stressing you out, right? But no, it's the isolation. And thank you very much. And then I had a hand right here. So you can thank your coworkers for all of their help and decreasing your cholesterol and things.
Also, I talk about interacting with your children, grandchildren, adult children, teenagers. It's very important. I have 4 grandbabies that live here. They go to 3 different schools. So it takes me 90 minutes to get them, pick them up, drop them off. So I'm able to pray with them before they go into the school. So that's a part of my interaction, to pray with each one as they get out of the car. And I thank God for that. And also, I'm in a senior citizen program, and I have a lot of fun. We all different colors and different races. We just get along so good. But like I was saying, they eat a lot. They have food everywhere, and I'm trying to cut down. It's hard. But JJ gave me some points. Him and his wife told me some things I need to do, to help me out. So I'm going to take that advice.
Very good. Thank you so very much. Now, we don't want to overlook anyone. Did anybody else want to share something before we move on? Okay, here we go. So I lost my people in the back there. They're working on the QR code thing. Kenny, while you guys figure out the QR code thing, can you switch it to the question QR code, please? All right, so we're going to be showing this QR code periodically throughout the day, pretty much after each session, so that in case the doctors cover some things that you have some questions about, that you can ask online. And then during our panel discussions, we're going to have 2 today. We're going to have one in the morning. We'll have one in the afternoon. Those questions, that's what we'll be using to run the panel discussion. So if there is anything that was on your mind, as far as like, oh, he mentioned something last night and I didn't have the time to ask him, or maybe you're just feeling a little shy and you didn't feel like asking them, you can actually just type it in there. That one should be working as well, though. If it's not, though, let us know. Sometimes things work the night before and then you show up and it doesn't work. So that's what the QR code is, but it'll be up periodically as well. Okay, so with that being said, I do want to invite our first speaker up, because I know everybody didn't come to see me. It's disappointing, I know, but you came to see some real experts, okay, talk about some things. And so we want to invite Dr. Jason Rosenfeld up this morning. And he's going to give us a talk this morning. His talk is entitled Health Through Community. But before we get started with his talk, we do want to just mention with him, just interact with him just for a second so we can get to know him, and so that we can, feel personable here this morning. So Dr. Jason, again, hello.
Thank you.
Good deal. Your mic is on. Just for a moment, because, they came to see you, not me. Mm-hmm. Tell us just a little bit about yourself. Do you have any kids?
I do. I have 2 kids.
2 boys, girls?
2 boys.
2 boys.
12 and 9.
12 and 9. You're in the thick of it right now, aren't you?
In the thick of it, yeah.
Thank you for breaking away today to come and spend time with us. So how long have you been in San Antonio?
Lived here now for 15 years.
15 years. So that came 2010 you came?
Just about, yeah, the end of 2010.
Good. That was easy math for me because I came in 2015.
Okay.
So, it's good. All right. So just curious, you don't need to tell us your actual address, but which part of town do you live in?
Kind of north central, just above downtown by Trinity University.
Okay. I know that area. I know that area very well. Okay. So how who invited you to this particular conference? How did you hear about this conference?
So I was invited by Prince, a colleague of mine at the University of Texas Health Science Center in the School of Medicine.
School of Medicine, and that's where you practice. What do you specialize in?
So to be clear, I'm not a practicing physician. I'm a doctor of public health, and so my career is always focused on helping people get access to culturally and linguistically appropriate information to make good decisions for themselves. So what I get a chance to do is teach medical students the value of community and thinking about health outside the four walls of the health clinic.
Sounds great. And so without further ado, we're going to give you the floor. Thank you
Great.
so much for joining
Thanks
us
so
today.
much. So good morning, everyone. How you doing? Good, good. So I'm going to wait, I think, for my slides to come up here. Let me pull my water up so I don't have to reach down for that. But it's really a pleasure to be with you all this morning. I want to talk to you for the next 20 minutes or so about some of the work that I have been doing both globally and locally to try to kind of build and rebuild community. And so, you know, the title of the talk that I put together today is Stronger Together, and looking about this concept of social well-being and how that helps us not just as individuals, but also collectively to kind of achieve our idealized state of health and well-being. So by way of introduction, I am a public health professional. My area of focus is in community-based health promotion. I spent the first half of my career working in global health, and so I spent about 5 years in total living and working in Southern Africa, and mostly around water, sanitation, and hygiene issues, which to me is like foundational health. And so, you know, there's all these global health programs that are focused on kind of more complicated things like HIV/AIDS, tuberculosis, and my argument was always that if we can't, as a community, figure out what kind of water we're going to drink, how we're going to store it, where we're going to poop, then like these harder things are going to be even harder to achieve. And so I cut my teeth working in rural African communities. And what's been fun, and I'm going to share it with you today, is thinking about how do we bring lessons learned from our global programs and our partners and our colleagues there to help address local health issues here in San Antonio in the United States. So I want to start with a very kind of brief story of a friend of mine, Cariña. So I met Cariña maybe 8 years ago. She lives down in Brownsville, Texas, down in the tippy tip of Texas, where I've done some work for the past 7 years. And when I first met her, she is a homemaker. She has a lovely family of 4 daughters, which every time I talk to her, I'm like, good luck with that, because I've been to 2 of her quinceañeras already, and don't know how they manage, but anyway, Cariña is an amazing woman. But when I met her, she was kind of stuck. You know, her husband was the breadwinner, leaving the house every day, going out to work, and Cariña was home with her daughters, and just kind of moving through life. And I think when I met her, she was having some chronic health issues. She was starting to feel a little bit of depression creeping in, because while family, as we know, is enriching, sometimes we need a little bit more to kind of help stimulate and keep our bodies moving forward and our minds fresh. And so Cariña was in a tough spot, and she was starting to have these complications with her physical health. Her social well-being was declining because she wasn't connected to people in her community in a meaningful way. And as a result, it was also then affecting her mental health, right? So she was starting to feel some of those kind of larger symptoms of depression and other issues creeping in. And so I want to kind of end my story with Cariña there, because I'm going to pick it up at the back end of my talk here to talk about the transformation of how she's kind of gone from where she is 7 years ago to where she is today, which I hope will kind of help solidify this talk. I like audience participation, so I'm hoping you'll engage with me. So, who wants to take a shot at defining health for me? How do we define health? What is it? This is a preventive health conference, so hopefully you have some ideas. Well-being. Okay, what else? No, Can you repeat that one more time?
Excuse me.
Well, health is a measure of where you are in life. Could be good, could be bad.
Okay, I appreciate that, right? So it's a kind of, you're looking at it from a holistic perspective, right? Kind of where you are at any point in time. Any other thoughts on what health is? Yeah.
Health is your body systems all in optimum condition.
Ooh, I like that. I'm going to ask somebody to help maybe expand on that. What do we mean by systems?
Being able to perform and be happy.
Okay, right. So like just the functions of our body doing the things that they need to do. And I love the happiness piece. We don't think about kind of enjoyment and happiness sometimes. What else?
So I would say health is, physical, mental, spiritual, and social well-being in balance.
Very nice. Thank you so much. Anyone else want to add to that? So if you ask the World Health Organization, which defined health back in the 1970s, this is their definition. It's a state of complete physical, mental, and social well-being. When I ask my medical students what health is, they usually say, when I don't have an illness, right? That is not sufficient enough to really define what health means. You guys were hitting the nail on the head. It's this intersection between our physical well-being, our mental well-being, and our social well-being. And if we think about it in the context of United States healthcare, we're really, really good at making sure when people get sick, we get them better, right? Can argue how well we do with prevention, but we're not going to go down that path today. Mental health is something we finally have started talking a lot more about, and we have recognition. I was actually talking with some colleagues the other day, and you know, it's impressive to think about, like, when I was growing up, we didn't have language for mental health. Didn't have language for emotional health, but my children are very well equipped these days to talk about their emotions, their mental well-being. And so we're finally starting to recognize the importance of our mental health. The one thing I don't think we spend enough time talking about is our social well-being. And it is an integral part of what makes us as individuals and as communities healthy. And so that's what we're going to focus on here today. So this was meant to be a question, but I'm going to pose it to you, and you can look at this image. So I want you to tell me, again, a little bit of audience participation, because it's morning. We all got to get moving, get the blood flowing, make sure we're all paying attention. What determines our health? So if you think about physical, mental, social well-being, what are the things that help make us healthy or make us less healthy?
One of those is going to be our environment.
Okay. Can you tell me a little more? What do you mean by that?
Where we live. Do we have access to a park where we can go walk? Do we have access to a grocery store where we can go and buy good fruits and vegetables? And there are people that do not have access to those things.
Right. If you go down to the south side of San Antonio, the closest H-E-B may be 10, 15 miles away from you. And so you're shopping at a Dollar General or maybe a Quickie Mart. So environment is a big piece of what determines our health and well-being. What else? What are some of the other things that influence health positively or negatively? College. So education is a key factor determining our health and well-being. When I was asked as a young master's student, where would I invest my dollars if I wanted to move the needle on health and well-being, I said primary education, right? The more we educate people, the more informed we can be, the more health literate we can become. Any other thoughts? Yes.
Actually, I said knowledge.
Oh, knowledge. Okay, knowledge education is kind of the same concept. So we got environment, we've got knowledge education. Yes, sir.
Your finances?
Yeah, money makes a big difference, right? So like even if I do have access to a grocery store, to other things, if I don't have the resources to then purchase the things that I want, then I'm not going to be able to necessarily achieve my idealized state of well-being. Yes?
For me right now, it's been physical. Going to the gym, doing things, and it makes me feel good. I get around other people, and we're doing it together. So it's been very enlightening to get into physical, to take care of myself healthy that way and do it that way. So it's been good for me. The physical part has been good.
No, I appreciate that. And I even think about when I first moved into my neighborhood, we had a big issue with stray dogs, and I did not feel comfortable walking in my neighborhood because I never knew whether or not a dog was going to come down off the porch and chase me around the neighborhood. And so this is the reality for many people. So whether you have access to a gym, if you don't have green spaces, sidewalks, then it limits your ability to engage in the practices that we may know we want to engage in. Yes, ma'am.
To have a strong community, either family or people, neighbors, children, to lift your spirits and keep you moving forward appropriately.
I love that. And that's what we're going to spend a lot of our time talking about here is the relationships around us, our families, our friends, our community around us, because we are social beings. We require human connection to be thriving. And this is part of what I've heard you talked about yesterday, so there's going to be a little bit of repeat from what you heard yesterday, but it never hurts to reinforce things we've already learned. Any other thoughts on what determines our health? You guys have covered a lot of ground. Yes, sir.
I know it sounds weird, but I think weather would
Sorry?
help. Weather.
Oh, yeah.
Because if it's not sunny, my mood changes, and I think mood can help your health. I know, sorry.
100%, right? It's hard to complain when it rains in San Antonio, but the last week when it was raining for 3 days and we didn't see the sun, it's like, oh God, like I don't know how people in Seattle deal with it because it's like 6 months out of the year. But you're right, I mean, and so this comes back to that concept of environment. And so the picture you're looking at on the screen is something in the public health literature that we call the socio-ecological model. And basically what it's saying is that at the center, what determines our health is our individual characteristics, right? Our age, our sex, our like other kind of genetic factors, right? They're inherent to ourselves, but then those factors are then influenced by our lifestyle choices, the behaviors that we engage in, the food that we cook. And then that in turn is influenced by the social networks and connections that we have, which is in turn influenced by these green circles, education, our work environment, our accessibility to systems and services, housing, water and sanitation. And then ultimately at the top level is this idea of kind of policies and systems that are then determining all of that. And so you can think about it as concentric circles moving down. And so I want to come back to this image a little bit later to think about, you know, when we talk about engaging in physical activity, when we talk about eating healthy, it's not just one person's choice. There's many factors that are then limiting or creating opportunity for choice that we may not have real understanding of. And the other piece of this that you guys highlighted very nicely is this concept of the social determinants of health. Have you guys heard of this term before, social determinants? Anybody? Yeah, a few folks. And so you mentioned, I think, almost all of these, although nobody mentioned healthcare access when I talked about what determines our health. That's the number one thing when I ask our students what determines our health, they're like, access to healthcare. But what we actually know is that access to healthcare only determines about 10% of our health. 70% of what determines our health and well-being is our social and community context and the behaviors and the choices that we engage in. So you talked about economics, you talked about neighborhood and built environment. What I want to talk about today is our social and community context and how this influences our health. So this may be a little bit of a summary from what you heard yesterday from Prince, but have you guys ever heard of this book, Bowling Alone by Robert Putnam? It's a book that was written in 2000, and he talks about it, this concept of social capital. Has anybody heard the term social capital before? Few people. So this is this idea of the social relationships. How strong are our relationships with each other? Do we trust each other? Do we offer each other social support? Do we work together to solve problems? And they've got different concepts within it that I'm not going to dwell on. But when he wrote this book, what he was talking about was the decline of social capital in the United States. So back in the day, right, from the 1900s up until about the 1950s, we were very engaged as a society, right? And he uses this concept of bowling leagues as his example, right? People were involved in bowling leagues, they were involved in card groups, whatever it might be. But over time, our engagement in these social groups has reduced for a variety of reasons, and we can talk about what those reasons are, but he highlighted this in this kind of what he called the collapse and revival of the American community. And then here on the other side is an article from The Atlantic that was called The Anti-Social Century. And what he was highlighting in this article was the same concept, but highlighted and exacerbated by the COVID-19 pandemic. And what he was saying was that when he went into restaurants, there weren't people in the restaurants. Everyone was going in, getting takeaway, and going back home. And so this has become this common trend for us, is that rather than retreating in community, we're now retreating into our households. So I always like to ask this question: how many people know their neighbors? And by that I mean you have a conversation on a regular basis, and if they ask you to do something for them, you would help them. I'm really glad to see that, because I'll be honest, I barely know my neighbors, and that's on me, I own it, but this is the kind of thing, right? We go to work, we come home, we go into our house, we cook our food, we go to bed, right? But we're not engaging in the same way as we used to with our neighbors and with our community. And so you heard these data yesterday, so I want to just kind of highlight them again. And so what we're seeing is this increase in social isolation and loneliness. And so I want to take a moment just to define the two of these terms. So social isolation is the physical distance between people. So it is physically isolating yourself, maybe in your house or otherwise, where you're not having as much contact with other humans. Isolation, on the other hand, is the feeling of being lonely, right? Sorry, did I get that backwards? So loneliness is the feeling of isolation. So you could be in this room and still feel lonely. And so it's important to keep those two terms in mind. And so what we know is social isolation affects about 1 in 5 Americans. 35% of adults in their kind of older years, 50 to 80, felt a lack of companionship. And about 1 in 4 adults reported not having social and emotional support from anybody, whether in their family or otherwise. So this is something that some researchers and writers have said is going to reach epidemic proportions by 2030 if we don't do something to turn this around. And I heard you guys throw this statistic out, but I'm going to repeat it again. So the effects of loneliness are equivalent to smoking almost a pack of cigarettes a day or having a diagnosis of obesity. And how does that happen? Well, it happens because when we're feeling lonely, socially isolated, the behaviors we engage in are oftentimes more detrimental. We're maybe sleeping more. We're engaging in drinking alcohol more than we otherwise would. But it also changes our biological processes, right? Our immunological functions decrease, our metabolic function can change, but also it increases our risky behaviors, and it also increases the risk for poor mental well-being, so for depression, anxiety, and stress. And so this intersection of health, right, this kind of triangle that you guys defined before, social well-being is influencing our physical health, it's influencing our mental well-being. But the opposite directions are also true. When we are not physically well, if I have an ailment, if I have an injury or pain, I'm less likely to go and be socially engaged, right? Which is then going to have an impact on my mental health. If I'm feeling depressed, if I've got high rates of stress or anxiety, then that's also going to affect my physical processings, and it's going to maybe keep me from getting socially engaged. And so it is a both virtuous as well as a vicious cycle, depending upon the individual and the way that we try to intervene. Anybody remember Vivek Murthy, one of our Surgeon Generals? So he wrote this book, and I forget because it's in my notes, but I think in his second term as Surgeon General, talking about this concept of togetherness and the impacts of social isolation in the United States. And he talked about kind of social relationships at 3 levels: the intimate relationships that we have with our family and our loved ones, kind of moving out into the concentric circle, then kind of our friendships and our social networks that we do fun things with, and then the kind of third circle is the people that we know, but we may not be constantly engaging with. And all of these relationships are really important. And what he was saying is that, again, just like with bowling alone in the Atlantic article, that there's a variety of causes, whether it's the rise of social media, the COVID pandemic, other factors that have led us to kind of retreat into ourselves. His cure for this was fourfold. He said, spend 15 minutes a day with somebody that you love. He also recommended it's okay to get used to being by yourself and contemplating, but don't do it all the time. But so get comfortable with not being on your screen, right? We tend to say, all right, I'm bored, here we go. And then we're going to scroll, we're going to see what's on our phone. What he's recommending is let's not do that. Let's just spend 15 minutes with ourselves, with our thoughts, so that we can capture ourselves and kind of move forward. He recommended volunteering, serving others, and the fourth one has now escaped my mind, and again, it's in my notes, but I'm happy to kind of share it with you. But I start there because as he was writing this book and making his campaign about addressing the epidemic of loneliness in the United States, I had started to bring a model that I had learned from Southern Africa to the United States that I think is working directly in this space. And so I want to start with this term and have somebody help me define it. What is a community?
Give us a second to get the mic to you real fast.
I'll repeat it. He said, so it's a group of people that help each other. Love that. Anyone else want to add to that? You guys are shy this morning. A sense of belonging, okay? So we oftentimes think about this concept of community as kind of a geographical factor, right? I live in a neighborhood and this is my community, but I like the way you phrase it because it can be beyond that, right? This is a community, as was mentioned earlier. You come together on a regular basis. Even if you're not a member of this church, you're coming here and you're part of this community. We're part of a variety of communities. But really what I think makes a community is shared norms and values, right? And so it's the things that we hold in common and see ourselves in each other. And what I love about this word is that if you look within it, there's something else there. And it's this concept of common unity. This is really what we want in what I would call healthy communities. This sense of unified togetherness, but also moving forward with action. And so oftentimes, if you think about that Bowling Alone article and the rise of loneliness, we're not involved working together anymore. We're involved working down our own pathway, and maybe we have some support, but we need to find ways to think together, to define issues and solutions together, but then also to take action with those with meaningful directionality. And so ultimately, that's where this intervention that I have been working with for the past almost 20 years now comes in. So this concept of the community health clubs, it was started in Zimbabwe in the 1990s. I mentioned already that I did water, sanitation, and hygiene work as a mechanism for improving community engagement and action around water, sanitation, and hygiene. Because water and sanitation, toilets in the international world, these are collective resources. These are things that we all have together. We all need them, but most programs focused on one person at a time. But the reality is that the only way we're going to address those things is by coming together. So the idea of the Community Health Club is just very simply a group of people that come together on a regular basis to learn, to share knowledge with each other, and to take action with that knowledge. And it's really important to emphasize this concept of the club because oftentimes health education programs, health promotion programs, they're kind of a diabetes program and then that's it. Or maybe it's a hypertension program and that's it. Maybe it's a mental health program. But people don't live in hypertension only. They don't live in diabetes only. We live in all of those factors at the same exact time. So we need programs and clubs like this one that can navigate all of those topics at the same time or in sequential order, and that's what the clubs really do. So they come together on a regular basis, they learn, they have fun, they sing songs, we play games, all with the goal of learning and taking action with what we learn. This concept of the club is rooted deeply in this concept of Ubuntu. Has anybody ever heard of this term, Ubuntu? Oh, I love it. So it's a term from South Africa, from the Zulu language that doesn't really have a direct translation, but in brief it means I am because we are. So we as humans only exist because we as humans exist. We can't live in isolation. As I mentioned before, we're social beings. We need human connection. We need human support. And so the club is tapping into this idea of bringing people together intentionally to talk about things that matter to them and to learn from others within their community, because we all have lived experience, right? Everyone in this room knows something. But oftentimes we don't know what that is because we're not given a chance to share with each other. And maybe you have a solution to a problem that I've been facing, but because we don't have a chance to talk about it, I don't get a chance to learn about that. And so then we wait for somebody else to come with a solution for us when that solution may already exist in the community. And this quote from Desmond Tutu, the other piece of what I love about this is it's not just the importance of the human connections, but it's also the realization that everything we do in our lives affects those around us, and we are affected by those around us, both positively and negatively. And so when we think about it in the context of behavior change, when I want to do a new behavior, it's hard for me to do it by myself. But if we're all doing it together, that becomes a whole lot easier to do. And so also what I do, there's a really good book called Connected that talks about how our behaviors, the things we know and the things we do, are influenced by 4 degrees of separation. So again, everyone in this room knows somebody, those people know somebody else, and even though I may not know that third person, I'm being influenced by that person in ways that I don't even know and I can't even understand because of our relationships and how humans interact. What's really cool, and I think this is my next slide, is that when we began to bring this program to the United States, and we were running it down in Brownsville with my friend Carina, we were asking our participants who had been with us now for over 7 years, meeting on a regular basis, engaging in club learning and collective action, we asked them, why do you keep coming? What is it about this that draws you here? And the word that kept coming back to us was convivencia. So for those of you that speak Spanish, you'll know what this means, which is just simply living and sharing together. It's the sense of Ubuntu, right? It's the same term that Africa has been sharing for decades, for centuries. Same concept is appealing here in the United States. We just want a chance to be together. And so what the club does and the way that we're able to generate this sense of convivencia, this Ubuntu, is we first create identity very intentionally. Every club has a name, we create slogans, and we sing songs. Right? There is something, and I think in faith communities you understand this more than others, there is something about raising your voice in collective song that makes you feel connected to the people around you. And so we do that in our clubs, right? And we sing songs about preventive health. We sing songs about hand washing because it also makes us feel slightly uncomfortable. And there's something good in that uncomfortableness that then moves us forward together. It also taps into this idea of knowledge democracy, which is just a fancy way of saying everyone knows something and we have to acknowledge those ways of knowing. And we learn more when we acknowledge your way of knowing versus my way of not versus, together with my way of knowing. We tap into experiential learning. So it's this idea of everything I learn, I'm going to apply. It's not just learning for learning's sake, but it's learning to take action with that knowledge as an individual or as a community. And that's what our bias towards action is. And then finally, the last thing is fun. As adults, how many people have been to a class and somebody is just droning on about some topic and they've got this monotone voice and you're ready to fall asleep? That's not what we want. What we want is to go and engage with our peers, to play games, right? We're all children at heart. We were all children at some point, but at some point along the way, we lost that ability to play. And so we don't just play, but we're playing for learning and we're having fun. And that moves us towards collective action and change. And these are just a couple of photographs from clubs that have been established here in San Antonio, which we began in 2021, where the picture on, I guess, your left is some of our club members on the far south side learning to make tortillas with applesauce. So for those of you that make tortillas, you're probably saying, what? what? It's actually pretty delicious. It's not as good, but if you replace the applesauce with your lard or your other fat, then you're actually improving your health and well-being, right? But they're also playing games, drawing pictures together. They have graduation ceremonies to celebrate their collective accomplishments of completing a curricula or doing activities. And all the while, they are working towards building their social relationships to affect change in their individual and collective lives. So I'm going to start to wrap up here. But what I want to highlight now is that what's important is not just having the social relationships, but thinking about how those relationships can help us achieve more that we can in isolation. So if you think about our health behaviors, and I usually use the example of kind of nutrition and food and cooking in this example, we oftentimes think about it as an individual choice, right? The things that I cook, I have chosen to cook those things. But the reality is the things that I cook, and I'm assuming it's the same for most people in this room, are things that my mom cooked, things that my grandmother cooked. They're things that my friends have cooked and shared with me, or maybe expect me to prepare because that's what happens in our social norms, right? But on top of that, in the environment, as you guys mentioned before, I can only cook the things that I have access to, right? So I'm going to prepare food that is based on the things that I can get at my grocery store, at my corner store, or otherwise. And so I start here because when we think about interventions like around nutrition, most times they are individually focused. I'm going to give you knowledge about using applesauce in a tortilla, and now you need to go out and do the thing yourself. But the reality is that it is normative. It is socially determined, the things that we prepare. So instead of focusing on the individual, we need to be focusing on the collective. And so bring people together to share their norms and expectations, and then have a consensus building process that then says, this is what we would like to do, and here's how we will do it to achieve the goal that we have set for ourselves. So when the group is now changing, we're all making tortillas with applesauce, it becomes easier for the individual to say, okay, I'm going to try that too. And then when the group is activated and they're beginning to feel confident and seeing success in the things that they've done, then they can work to begin to change the environment, right? So if we need a grocery store in our community, if one person is just out there banging the drum, nobody's going to listen. But if there's an entire community of people saying that this is what we want, it becomes much, much harder for people to ignore that. And so my argument and what I think the value of the clubs here is that it's a social relationship building endeavor, but it is also an endeavor towards building collective action towards issues that the community itself has identified and is now motivated to begin addressing. And so in this way, what's really neat about this model is that it is not a physical health program. It's not a social health program. It's not a mental health program. It's all three combined. Because when we form a club, when we bring people together intentionally to talk to each other on a regular basis, and let's say we have a topic on nutrition, my physical health is going to start improving, right? I'm going to make incremental changes because my group is starting to make those incremental changes. But on top of that, now that I'm seeing that and I'm together with other people, I'm feeling connected, my social well-being is improving, and as a result, my mental health is also improving. And then maybe the next topic is we're going to talk about mental health, and now I'm going to understand, oh, these are the sources of anxiety in my life. Somebody has shared a solution to that, and now my mental health is improving, which now in turn is improving my physical health. And so it is this beautiful virtuous cycle of bringing people together to improve all three levels of well-being simultaneously through collective efficacy, through positive peer pressure. This is the piece that I always talk about, is everyone thinks peer pressure is a negative thing. We can utilize it in a positive way to help people nudge along towards a healthier life and behaviors. And so this brings me back to Carina. So Carina was in that situation where she was feeling isolated. She was beginning to feel the mental health effects of that. Her physical health was beginning to decline. And Esmeralda, who is my friend and colleague down in Brownsville, began a community health club in her neighborhood. And so Carina joined. She's like, I don't know what this is. And she had a little bit of resistance from her husband, who said, no, you need to be at home. You need to stay with your daughters. And she said, no, this is important to me. I'm going to go and I'm going to do this. And so she participated in our nutrition and physical activity curriculum. And within 6 weeks, she had begun to be engaged in walking with her neighbors. She had started to change the cooking practices in her household, and she was feeling better, and she was feeling mentally well, and she was beginning to address some of the chronic conditions that her doctor had highlighted for her. And so she had cracked the code for herself through this social network program. And what's really cool about Carina is that she then said, wait a second, like, I am feeling so good in this way, I want others to feel this way. So she told Esmeralda, I want to start my own club. So she went and started another club in a neighboring community. And now she's a certified community health worker that has 4 clubs that she's supporting down in Brownsville, all with the goal of helping to build these social relationships to help people address the issues that they've identified in their own community. So that's just one quick story from Carina. I'm going to end here, which is, so whether you're going to have a club or not, I use the club as the context and the kind of the table on which I set this conversation because it's the work that I do. But some of the things that we can do to address our social well-being and utilize our community to help improve our health and well-being is, first, let's just reduce the amount of screen time that we're using, right? I know I have to do this. It's so easy to just kind of roll onto your screen. But let's think about intentionally, how do we reduce the amount, whether it's our phones, whether it's our TVs, our computers, or otherwise. Find ways to then find your group, right? So that's what that picture of the light bulb of people putting it all together. So if it's not a community health club, find a book club. Find a sports group. Go watch some sports with somebody. Even if you're watching a TV show with somebody and then talking about it afterwards. But find your group and make sure you're intentionally connecting with them. This idea, the talking to strangers, this is a book written by Malcolm Gladwell, who is one of my favorite authors. But what he's saying is, like, just go talk to a stranger. Like, how many people have spoken to a stranger in the last week? Good for you. It's nice because you're going to learn something you never would have learned. And so, like, just be open to greeting people on the street or on the wherever you are in the grocery store, because it's going to expand your mind. It's going to expand your relationships. Host a dinner party. These are simple solutions. Just invite 5 friends over, and then those 5 friends will probably invite you back over, and then it'll become this kind of virtuous cycle. Host a block party. These are the things that we can do to get our community back engaged with each other. And so these are just some of the ideas that I wanted to throw out there. I think I'm going to go ahead and wrap it up here. And so I wanted to thank you all. I put 2 websites up here for a program that I run called Health Confianza that has some resources around peer-to-peer education, this idea of social well-being. But I wanted to thank the Prince for the invitation to join you here this morning. I don't think I'm supposed to be taking questions at this time, but I will if I'm allowed to. So
we are having a panel discussion just for that. And speaking of that, Kenny, will you put up the QR code for questions, please? That will come up momentarily, and so that we'll use those for questions. So there's the QR code. If there's anything he spoke about just now that you have a question about or even a comment, go ahead, fill out the QR code, and when we do our panel discussion, we will get right to those questions as much as we can. And I know that you're taking pictures of the QR code, but if we could please show our appreciation, give him a round of applause, please, for the great presentation. Had a lot of good information there. He mentioned some degrees of separation of things like that, and the theory is 6 degrees of separation, that you are all kind of connected or something like that. I have my own theory about degrees of separation here in San Antonio. Would you like to hear it? Okay, my theory is that there's 1 degree of separation here in San Antonio that I guess it's 2, that you know someone who knows someone who has or does work for USAA. It's true, right? Like, somebody who works for USAA. There's probably several people in here right now who work for USAA as well. Okay, so we also want to be active in between. We don't want you just sitting all day long. Okay, so we're going to take a quick break, but based off of the information that we just heard, we're going to take about a 5 to 7-minute break or so. Based on the information we just heard, we want to try and do this call to action now. If you were here last night, I made a call to action as well, very similar. I was like, before you leave, I would like for you to try and meet one person that you have not met, that you have not seen. Anybody that was here last night, did anybody have a chance to do that? You met someone that you didn't know. We're going to do that again right now as we take a 5 to 7 minute break. Again, water fountains are, actually that one I'm not sure is working, but there's another one down the hallway that is working. And if you can't find it, please ask me. I can show you where to go. But as we go to, and the restrooms are right outside the door, as you kind of take this 5 to 7 minute break, let's talk to strangers. Okay? Let's not just talk to the people that we know. Talk to strangers, somebody that you have not met just yet, and we will come back. Okay? So in that 5 to 7 minutes, try and meet one person that you have not spoken to before. right, all right. Not sure if that was exactly 7 minutes or not, but we were close. We were close. I see that many of you were meeting new people, and we're going to take a moment on that in a second as we come back to our seats. Definitely like to have those breaks so that everybody is not falling asleep. Get the blood active. All right, all right. You guys can go ahead and lower my music in the back, please. Thank you. As you can see during the break, we've had the 2 QR codes rotating. We've had the health questions, and we've had if you need translation as well. So before we begin with our next speaker, I want to see if someone actually did my call to action. I'm going to ask 2 people. 2, raise your hand for me if you met someone new. If you met, oh, okay, let me come around real fast. Come around real fast. All right. Listen, here we go. We got to see. Anybody have a preference who wants to speak? Okay.
I met Catherine and David over here. I'd never spoken to them previously, so it was nice to chat with them.
All right. Very good. Very good. I got someone over here as well.
I met Sarah and Ian. I saw them on TV last night when she was speaking, saying she was from New York, where I lived for 40 years. And then she went to Jersey, and then now she's here in Texas. So I wanted to make her welcome.
Very good. Very good. I'll take one more if someone wants to introduce somebody that they met. Anybody? Any takers? Okay, well, we'll do that activity again later on today. I'd like to go ahead and invite up my next speaker, our next speaker, my friend Dr. Ben. Dr. Ben, I just know you as Dr. Ben. I don't even know your last name, actually. I'm not even going to try to pronounce it. I'll let you do that. Good to see you again, my man. This is our 3rd year together, and so we're like brothers now. Dr. Ben, same as usual, just for people who don't know you, we're going to ask a few questions. We kind of went over a few things beforehand. And so, Dr. Ben, you currently live on the East Coast. In which area? Is he on in the back? Let me see if we turned you on. Let me check. Yes, it's on. It's on.
Okay.
There we go. There we go.
Yeah. So I live in the East Coast. I live in southern Maryland, around the Montgomery County, very close to D.C.
The DMV area?
The DMV area. So those
Very
of us
good.
who know the East Coast, D.C., Washington, it's kind of like convoluted together, 3 states in one.
3 states in one.
So we call it the DMV, not the driver's license. But.
Hey, got you. All right. So where did you go to school?
So I've been all over the place. It's a whole story, but
let's keep it brief for just
let's
now.
keep it brief.
Okay, there we go.
I had my grad school in Loma Linda University. That's where I had my doctorate, and then prior to that, I also had gone to Purdue University to pursue a degree in pain neuroscience because I was dealing with a lot of patients with chronic pain. And then I also did a postgraduate diploma at the Liverpool School of Tropical Medicine.
Okay.
Yeah.
So you have been really all over the place. Very good. Let's ask something a little less serious. Do you have a favorite food?
If I mention my favorite food, I think that, but I like a typical plantain, boiled plantain with spinach stew.
Boiled plantain with spinach stew. Can't say I've ever pictured those two together. You know, it's interesting.
But if those who have lived in the island knows the ripe plantains, the well-made ripe plantain. How many of us are from Jamaica or any of those places? Yeah. If you ever had a ripe plantain, yes, so they know that.
Okay.
So there's the green part of it, the unripe one, is also a delicacy.
Okay, all right. Well, just any other thing you'd like to share with us before we get started? Anything about your personal life that you'd like to share, that you'd like people to know?
The other thing personally that I want to share is the fact that I run every weekend.
You run every weekend?
I run every weekend. I do either 5 or 10K every weekend.
5 or 10K. But they have robots that do that for you now. I don't know if you guys saw that video.
AI does everything right now for us. So, but it's never enough for us to to
Very
get there.
good.
But I
Well,
think
I'm
that
glad you mentioned that because we're going to be talking about our 5K a little
Yes,
bit
this Sunday.
later this Sunday. But we're going to make that announcement a little bit later on. But without further ado, let's give a hand to Dr. Ben. How do you pronounce your last name?
Opoku.
Opoku. Dr. Ben Opoku.
Hello. To the Adventists among us, happy Sabbath. Okay. I think, AJ, when you asked us to do something, and I'm so excited that Dr. Jason, thank you so much. You've taken a lot of the work out of me. And I was like, what am I going to talk about? Because he's talking about a lot of the things that we already had. Yesterday, Dr. Prince led a very nice presentation, giving us the statistics. Part of it I already had. I'm like, man, these guys, they're already leading us in most of the things. But AJ, this is something that I observed. Thank you. Something that I observed when you gave us the assignment, I already had that in mind as a way of a physical activity. Anyone that have seen me here the past 3 years, I'm a very active person. And I move a lot. And I realized that a lot of people didn't do what you said they needed to do. They didn't do the homework, but I know you had good people actually giving you an example. So this is what I'm going to do. For us to start, I want those of us here in this row, I want you to move and go all the way to that end and go talk to somebody right now. Let's do that. And then those of us in this row, you're going to get up, please. You're going to go to this lane and talk to somebody you've not talked to today. Right now. Let's do that. If I don't see you moving, we are not going. So I want you to see you talk to somebody right now. And I want you to ask of their name and what they do. All right, I think we can take our seats now. Good. Yeah, I've been told that my mic has been disconnected because you're all having a good time. How does it feel? How does it feel? Okay. It feels good to talk to someone, right? You know that in this world that we live in, people will assume intent for you whether you like it or not. Right? Do you agree with me? That as we live here, when you walked in here, when you see someone, you assume intent for someone whether they like it or not. Right? If I sit here, okay, and just say you see somebody standing by a car with a nice tag, with a sheet of paper around the car, what will you assume? Probably a car salesman, right? You see somebody in a white coat with maybe a stethoscope on their neck, what will you assume? It's what?
A doctor.
It's a doctor. But is it always true? So if I want to know what the truth is, what do I need to do? It's either I what? Talk
Ask
to them or what? Ask them. But a lot of times, we are not doing that. In our world right now, there's a common thing that I'm hearing repeatedly. It's lonely at the top. How many of us have heard that? It's lonely at the top. So the question I ask is, why is it lonely at the top? Because we live in a world that is telling us that you need to build wealth, build status, and build independence. So we are all rushing to build what? Wealth, status, and what? And independence. Then you finally get there, and then you say it's lonely at what? At the top. So the question is, why is it lonely at the top? Can somebody share some perspective? Yes, please. Because you what? You are by what? Yourself. Okay? What else? Why is it lonely at the top? Why is it lonely at the top, Doc? So you scramble over what? So many people to get to what? To the top. There's a famous African saying, and I don't know whether you are familiar with it. It says that if you want to go fast, go what? Alone. So when Dr. Jason was talking about Ubuntu and all those things, there's a very nice, powerful. He said that if you want to go far or you want to go fast, you go what? Alone. But when you want to go further, you go what? Together. But in our fast-paced world, people have been taught to go what? Fast. We want the first person, the fastest newspaper to report what? The breaking news. The fastest person to do this. And we are all racing to get to what? To the top. And then when we get to the top, that is where your statement comes in. We burn so many bridges and destroy what? The very things we need when we get to what? To the top. So that is why we are what? Lonely at the what? At the top. Yes?
When you're at the top, everyone's looking at you and judging what you do, and you're just trying to stay on top.
Okay. So you are just there, and everybody's judging, and you're trying to stay what? On top. So all eyes are what? On you. But maybe if you spread the love, then you wouldn't be the focus, right? Because we are all looking at what? Each other. So we wouldn't have that tunnel vision of looking just only what? You. There's a study, what we call the Adult Development Study, the Harvard Adult Development Study. It's one of the longest running study that have ever been produced. Over 700 sample size. And they come to this conclusion. And the conclusion is that good relationships keeps us happier and healthier, period. You can just take your phone and Google it out. The Adult Development Study, the Harvard Adult Development Study. It says that what? Good relationships keep us what? Healthier and happier, period. You know, as a clinician, I was trying to find it hard to believe until I started looking at it. And part of it, Dr. Jason mentioned, because I was going to mention that imagine that in this church, we have a community health club. And in that, we have a nutrition session. In that, we have what? A fitness session. In that, we have accountability session where we hold ourselves accountable. How far do you think we're going to go? Any response? How well do you think our health is going to go? I'm struggling with diabetes, maybe because I don't know how to cook a real good meal. But you are so resourced in cooking. But you're also struggling on how to be what? Fit. But I have that knowledge. So by you bringing your resource, I'm bringing my resource, you bringing your resource, you see how community works? Because you have an experience, even as clinicians. I have a friend who is a cardiologist, he knows that. Dr. Brian is here. Dr. Usher is here. I have a friend who is what? A nutritionist. Imagine we have a group that have all these what? Varied specialties. How we are going to help our communities. But we live in a community whereby we've been told that do it alone and go to the top. And then you get there, you realize that, yesterday I was saying something here, that you have a house and you have a 16-seater movie theater in there. You've made the money. Why do you have a 16-seater movie theater in there? Any perspective? Why do you have a 16-seater? Meaning you want 15 more people what? In there. But if you burn all the bridges with all the family members, your cousins and your sister, and everyone, who is going to sit there with you?
Just you.
It's just what? You. So you see how empty it is. Yesterday we learned all this, and I just don't want to take the time for us to, because yesterday we learned this concept that, and Dr. Jason helped like that, you can be alone in what? In a cloud, right? And then you can also be alone, but not what? Lonely. Dr. Jason just established that right now, and I don't want to spend time with us going to that. But most of us, sometimes we find ourselves in a group and we are lonely. Right? And that is why I made us do all the things that we do, because it can happen that somebody will be in here and walk out and never said a word to anyone. And we need to break that barrier. I started my conversation here by saying that we all assume intent with people because sometimes we just look at people and we stereotype them. It's natural bias. But how many times have you spoken to one person, even in church, even at work, and then you are like, this person, that is not what I thought he was. Right? Oh, that is not how I thought she was. She's actually a sweet soul. Oh, he's actually a nice person. Or he's actually a horrible person. But he kept this facade. How did you get to know that? By talking to what? To them. Our world is teaching us to, and yesterday we learned all about this. Today we've learned about that. I don't want to spend our time. But we've gotten to know so far, we've learned that loneliness is leading to 29% in heart diseases, 32% in stroke, 50% in what? Dementia. Loneliness. So you now understand that living together is a good, by the Harvard study, is a good predictor for what? Your health, and for you to be what? Healthier. Do you understand that now? So if this is the established fact, that loneliness also is associated with depression and anxiety, premature death, and weakens immune system. Dr. Jason mentioned that right now. Maybe when we get time, we're going to talk about the details of that as we go along, how these things happen. So these are established facts. And then we know that 50%, whenever you have social connections, it increases your odds of survival by what? 50%. Your odds of survival. And why? I just gave a practical example. We have a community health club, right? The example that was given by Dr. Jason. Somebody is teaching us nutrition, right? How to cook. Good, healthy, maybe vegetarian meals. Maybe you want to start vegetarian diet based off your health condition, but you don't know how to do it. Somebody is helping you with that, right? You want to go on a fitness journey. You don't, but somebody within the club have that. So you see how we can improve our survival by that? Does that paint a good picture? We are helping ourselves. And that alone will help us with our longevity, our mental health, and our what? Our resilience. But most times, and it will strengthen our community and our economic what? Productivity. Because when you are strong and I am strong, a lot of our taxpayers is not going to be used to take care of people who cannot work. Have you thought about that? But the more we are sicker, the very few people who can work, oh, Uncle Sam is going to tax you to the bone. So that people can get more what? Benefits. And you are sitting here angrier because you feel that you are being taxed and your money is being used to give people benefits. Because they can't work. But how about we help them to get stronger so that they can go work so that your tax bracket goes down? Does that sound like a plan? Is it not a good plan? Good. So we've established all these facts. Now, we've also known so far that the cause of this loneliness epidemic is one, our increased digital what? Interactions. How many times have you even been in a group and all you've done, even in the midst of even here, all you've done all this was to be on your phone? And not say a word to what? Anyone. How many times in our home? Let me give you this example. I did a little bit of home health. I was working with an orthopedic group, and as part of our protocol, we used to visit our patient. And one of the interesting things that I found yesterday, I was talking about it, is that I went to see one of my patients that have had knee replacement. And for her, the entire knee replacement that has been happening, she had in her fridge, yesterday I mentioned it here, 2 months supply of processed food. All because when she had to go through the surgery, she has no support. So she has to have all those prep food process there so that as soon as she can a little bit hop, she can go and get the food. Do you know that her knee replacement became septic? And then had to go back for them to do revision of the whole process. Another patient, even more aged than this person, she was just 65. This lady was 85. But she had so much support group that within 2 weeks she was walking. So I sat back and asked myself, what were the two things? Just imagine, even in terms of pain, we know, even in pain management that patients that have good support system, they take less pain medications, they have more recovery, and they have better outcomes. Those who do not, 24/7, their brain is on that pain 24/7. It doesn't switch off. The amygdala in their brain is on a heightened. The fear response is what? Is going over the roof. At this point, even as you are here and we are talking, even if you are in pain, you know there's a point whereby you are so engaged that your brain switches off from that pain that you're experiencing. Right? So imagine that even when friends come and visit you, when you have a problem, within that period when they are there, how do you feel? You forget all about your what? Your problems. It gives your brain enough time to reset or to rest. But just imagine that 24/7, your brain is just running on the problem that you have. How does it affect your health? So you understand why these things happen a lot. Yesterday we went through these statistics. But since 2016, 45% of American felt they could not reliably trust other Americans. However, that proportion has shrunk to 30% in 2016 and is going down. Do you know why? The stereotypes. Because as community, if I'm not in any kind of relationship with you, I have distrust for you. Right? And that is why even the political divide have gone up and becoming even so huge. Because we have less interactions and we have more distrust for ourselves. Because we assume intent for what? Each other. Without even getting to know that. So, if that is the statistics, the other thing that I found very fascinating is that in 1960, single person household in the US was just about 13%. Currently, that has rose to about almost 30%, single person household. We are becoming more what? Individualized and isolated as we what? We go, because that is what the world is teaching. Self, self, self. So you are going to more empty homes, and people are now getting into vices because people are now having less social interaction. I like it when Dr. Jason brought that image whereby people now even go to restaurant, order, and then they what? Recently, there's an article talking about that 50% of American men don't know how to even approach women. You see, the women are saying true. Why? Because we become so individualist that even our ability to even communicate is non-what? Existent, because we communicate through what? Our phones. Even at home, parents are talking to their kids through what? But we've had enough of these statistics. So since we've had these statistics, the question that I'm asking that every year the rate of loneliness keep on what? Increasing. And we need to do something about it. And it had all this effect on inflammation and other things. So of all this talk and other things that we talked about, the question is, what does physical activity, how does physical activity fit in? How does physical activity help us to solve this problem? One of the ways is that physical activity creates what? Interaction. It helps us with shared goals, and it brings community what? Bonding. How many of us here are involved in any health club or any health group? How many of us? Okay, I have 1, 2, 3, 4, 5, 6, 7, 8. So just imagine all of us here, only 8 people are involved in any health or fitness what? Group. So just imagine the state of our what? Our health. But I'll tell you the reason why this is so important. Regular physical activity through the past 3 years that we've been having here, we say that it reduces what? Depression and anxiety, improves mood and self-esteem. You know, the more you interact with people and exercise, how many of us, those of us who are involved in physical activity like clubs, dog, how does it feel? Amazing. Can somebody tell us, when you go, what are some of the things that you do? You work out. And how does it feel after working out? Okay. See, if they go there and then another person is not there, they want to go visit and find out what? Why that person is not what? There. So they are holding that person what? Accountable.
What did he say?
Ma?
Well, I think we missed my point already.
Okay. Please say it.
Already. But we do walk with a doc.
Okay.
And that is a healthy thing, twice a month. And if anyone is not there, we look into it. We also learn about things that we're worried about from the doc that's leading the walk with a doc.
Thank you. And you know that walking with a dog as a group, do you know how many, one of the most underrated exercises is what? Walking. So just by community, we walking our dogs and interacting, not only are we creating connections, but also we are improving what? Our physical what?
health. So it means that when we do these things, because the most important thing is that across the globe, social relationship, particularly with family and close friends, as the most important source of meaning, purpose, and motivation in their lives. So how do I create friendships? How do I create family? For me, in my life, one of my philosophies in life is that family is not just bloodline. That is my definition of family. Family is not just bloodline. But for me, family is anybody who opens their doors to you. That is my personal definition of family. Because personally, I have had more opportunities and other things in life from friends and people than actual family did. That is my personal experience. I'm here today because of friends. How many of us have had opportunities that friends and connections actually open for us? So many of us, right? But how did that happen? Because you were connected. They knew of an opportunity that you never what? Knew of. So if all your time is on the screen, how do you create connections and how do you get opportunities? Recently, friends of ours decided that they wanted us to have, they were all over the world. Some of that in Europe, North America here, Africa. And then they said that one of the guys sent a message on a WhatsApp group and he said that he has observed that most of the men, after they hit the age of 30, were developing pot bellies. So he reached out to me and he said, you have an expertise in that. So what we're going to do is that we are going to do a push-up challenge. And the push-up challenge was that, recently the American Heart Association put up a challenge, right? The push-ups. But even there, they said push-up challenge. 100 push-ups in a day. Oh, you say, wow. But when we started, the goal was that we're going to hold ourselves accountable. And the 100 push-ups, you have to spread it throughout the whole day. You have 24 hours to do 100. So even if you decide that you're going to do just one at a minute, go do whatever and come and do one. The goal is that at the end of the day, you do what? 100 push-ups. Friends, this is just an adulterated study, but I was surprised the outcomes. When the guys started posting pictures of themselves before and after in a 3-month period, it was staggering. Some of the guys even told me their marriage has improved because of that. You see how physical activity is improving? Now, because of that, I was there. There's an opportunity that was being opened, and one of the guys reached out and was like, oh, Dr. Benny, I think you'll be the very first person to actually do this. Opportunities. So what we are saying is that exercise and these things actually help. So what exercise does is that it builds friendships. It encourages what? Accountability. It reduces what? Isolation. And one of the ways that you can do is that we can have walking groups. Ma, you talk about the dog walking. You can have fitness classes. So in our community health group that we are going to create, thanks to Dr. Jason, we are going to create from onwards, we're going to have things like that. Sports teams. We have church health ministries programs. And I'm going to hold Pastor and Cedric Hill Church accountable. Because I remember 3 years ago, Dr. Prince, we said that the 5K, every other month, we're going to go on a walk or on a run. How is that going? How's that going? Are we doing it? We've stopped. So it's not going to be a yearly 5K. But AJ is here. From tomorrow, every month, Cynic Hill, and God is my witness, you are going to go on a 5K walk at least once a month. Say amen if you're going to do it. God is my witness. Oh, the amen is so feeble. But just imagine how the church moved. And anytime, how many of us have participated in the 5K before? The 5K that we've done. Even if you came around, how does it feel when you came around? It was nice. That is what physical activity what does in creating social what? Connections. One thing I would say, even among our young group, in this study, they say that social isolation is arguably the strongest and the most reliable predictor of suicidal ideation among our young people. You know why our kids right now are very suicidal? For almost all the elderly people here, when we were growing up, we were rather being told to come back what? In. Right now, parenting is so difficult. I was just telling Beryl, Prince, when we were growing up, you know, we take the soccer, and then in the street, we are what? We're playing. But now, if a parent right now and your child sign up for a soccer practice, music class, and everything, your life is what? Over. Because you have to be there, chaperoning them for the soccer practice, right? For the music class, and it's overwhelming. But our kids, how many times have we seen a lot of kids doing drugs just because of what? Lack of proper social interaction. The AI and being on their phone all the time is what? It's killing them. So if we want to prevent that, it means that when you as a parent, when you are going out for the walk, your child can follow you what? And go for a walk. When you go for a run, your child is going with you to go for what? Run. In fact, in the fitness world, it is known that parents that are physically active, their kids are also physically what? Active. Because the kids learn by what? By observation, right? So they see, and let me give you, I forgot, maybe I'll share that. I have a video. My eldest son apparently have been seeing me doing the push-up. And secretly, he had been practicing to beat me. So let me tell you this. I went home, and then he and the brother and the sister is like they have a well-rehearsed thing just to humiliate me. So the brother had set up a camera, and then the elder brother was going to challenge me. So this is what they did. So he took it like mine. Hello, ladies, and you know, he's just acting like, you know, how they announce like the fight. Today, here goes my father. And today, in his corner, he's going to be challenged by Jason, down Opoku Bediako, and they are going to have a push-up challenge. You know, before I could put my bag down, he has taken his shirt off and ready to go on there. And I'm like, I'm just going to make a statement to this guy that he's still a child. The funny thing is that we started push-up, and apparently the sister have taken the camera and was videotaping for evidence. And then we were doing the push-up, and you know, because I've been training with these guys, trust me, when I started, I could barely do 10. But on this time, because I built up so much, we started and we're doing the push-up, and then at 50, this young man has started going, and my son is turning 17. So young person, he think he's what? Boisterous, he have the energy. I'm like, guy, you know, I have the experience. And then we started going the push-up 5, 10, 50, and then by 50, he's already tapping out. And guess what the sister did? The sister came to sit at my back so that I wouldn't be able to continue. After the end of the day, I took the video and I'm like, I posted it to all his friends. And I'm like, you better go train and come back better. But what am I trying to, it taught me some important thing, that they are what? Observing. So it means that if we want to avoid most of this depression and other things, then we need to do better. Because right now we know that a 1 unit increase in social capital, 1 unit increase, increase in social capital increase the livelihood of survival by 17% and self-reporting good health by 29%. One increase in social what? Connection. That is the effect on our health. So to conclude, what I'm saying is that the evidence in group exercises and activity is that it makes you more what? Consistent. You know how many times you don't want to do anything, but a friend will come and drag you? It makes you feel higher, like happier. You feel good and you have good what? Support what? System. And that is why we need to hold ourselves accountable, because in these years here, in one particular study, it says that social media for more than 2 hours a day had about double the odds of reported of increased perception of social isolation. 2 hours. Compared to those who did 30 minutes, only 30 minutes less. But you know the interesting thing? Most of us will tell you that we don't have time. But we can scroll on our phone for 2 hours non-stop. The question is, where lies your loyalty? What is more important to you? Your health or the needless banter on the phones? That is raising your blood pressure because you saw a video that triggered you. But you could have used that trigger to do something within 30 minutes that is going to improve your life. So as I conclude, what physical activity does is that it brings about what? Face-to-face interaction, meaningful what? Engagement, and then it decreases the passive what? Screen time. Friends, in a nutshell, what I'm also going to tell you and draw this conclusion, and I just want to say is this. Our church here, or this community that we've created here, if you are here, you are watching us online, is that we need to launch fitness challenges. We need to organize, create intentional spaces for communities. And Dr. Jason and Dr. Rocha have given us an opportunity to do that. We need to host health clubs. And that is a challenge I want to leave with everybody in here. I'll be happy even if I'm not here next year, that this group, we've connected and we started creating any form of class in any of this category. Just imagine how we're going to. Yesterday we learned something, and I want to repeat. Social connection and using physical activity to do that is as important as food, water, and air to our survival. God bless you.
Dr. Ben has laid down the challenge, and so I will begin with my 2 push-ups that I can do about right now, but hopefully by next year, I'll be up a little bit higher. A little bit higher. Okay. So, as we are about to take a quick little break, real fast, we're going to ask if we can throw up the QR codes again. I don't know where Kenny is, if Kenny's in the back or not. We're going to have QR codes up eventually here where you can ask for health questions. We're going to take about just a 5-minute break, let you use the bathroom, get some water or something, get some shake it off a little bit. So you wake up. We don't want you to be falling asleep, okay? So with that being said, it's coming up in a second. But with that being said, 5-minute break time is 11:54. By noon, we will be back up here and we will be sitting and waiting for our next presentation. we come back. It's 11:59. I'm a little bit early, but as you can see from our schedule on the back, it's more of a suggestion at the moment. We're not exactly on time exactly, but have we been having a good time? Getting some good information? I really have been enjoying the presentations, and we have one more that's coming up, but I did want to share a quick story while we wait. Dr. Ben was sharing that, sometimes you don't talk to people sometimes, and then they're not, when you finally do talk to them, they're not exactly as you had imagined. And I have a personal experience with that. Like for years, I was coming to this church, and I was involved, and I was active, and I was single. And, and there was one day that they asked me to do something. Some people moved away, and one of the pastors at the time had asked, he says, AJ, you know a lot of people in the church. We need someone to tell, the children's stories. So can you just reach out and kind of schedule it till we find somebody? I said, no problem. So at the time, we had this church directory. I opened it up, and I started looking through, and I was like, oh, yeah, that's that lady who I can never remember her name. It's like, it rhymes with Corona or something. Morona, that's her name. I remember she's got an accent. She's from somewhere. I don't remember where. I'm going to call her because I'm sure she's got some great stories from where she grew up. And so I just sent her a text message. Didn't even have her number in my phone. Just got it from the church directory. And then I said, hey, in about 5 minutes, I'm going to call you. She says, okay. Pick up the phone. We end up having an hour conversation. And I said to myself, well, that was unexpected. I see this lady from time to time from church, and I don't even know, really didn't know anything about her before this conversation. Fast forward a year and a half later when we got married. Look at that. See, you never know, who you'll actually talk to at church. Very good. But without further delay, I would like to invite Dr. Schwartz. Am I saying that correctly? Schwartz, yes. Don't ask me to spell it, please, okay? Dr. Schwartz, you told us a little bit last night about yourself. For those of you who missed it, he just got back from Malawi. It's in Africa, for those of you that don't know that. Anyway, doing a couple of things. Is there anything else that you'd like to share with us so we could get to know you? If not, I'm going to ask you just 2 questions, and I'm going to get out of the way.
Okay, you can ask me.
Okay.
You can ask me questions.
Will do. Are you on? Let me see if the green light is on.
Green light's on.
Let's see if we turn him up a little bit. Is he muted? Let's do a test now.
Okay.
All right. I think they can hear you now. Okay. So Dr. Ben shared with us his favorite food, plantains and spinach. Still trying to wrap my mind around that one. But how about yourself? Do you have a favorite food?
Yeah, my favorite food is tabbouleh.
Oh, the Mediterranean.
Yes.
Very nice. Very nice. Okay, all right. And then let's just go. Where did you go to school?
I grew up in Michigan, went to Andrews University for undergrad and Loma Linda University for medical school.
Okay. What is your specialty?
I'm an interventional and structural heart cardiologist.
That's a long title there. So when you introduce yourself, do you use the whole thing, or you just say you're a doctor? Anyway, it doesn't matter. It's okay.
I'm Brian.
It's okay. All right, well, let's do one other thing, then I'll let you get going. Do you like roller coasters?
I cannot stand roller coasters.
Okay, got it. Good deal. All right. I'm not a big roller coaster fan. My back now is not what it used to be, but it's okay. Without further ado, let's give a hand to Dr. Schwartz, please.
All right. Well, good morning, and thanks for all hanging in there through the morning. We're a little bit behind, but we'll try to get through about 30 slides as quick as we can, and hopefully we can do that quickly. So you've all heard that you are what you eat. For this morning's talk, I'm going to just call that you are who you eat with, since we're talking about community and nutrition. So I know many of you have heard about Blue Zones. I was just talking to Dr. Steve about it. This book came out by Dan Buckner back in 2023, and so fairly recent. I'm just going to go through a few highlights that he had in his book that kind of make the illustration for what we want to talk about today. And so There's only one recognized Blue Zone community that Dan had in his book, which featured Seventh-day Adventists at the place I went to medical school, which is Loma Linda University. In Loma Linda, California, it turns out there are more people that live to be 100 than in any other community in the United States, and there's multiple other communities around the world that he had identified this way. But many people that make it to 100. So who are Seventh-day Adventists? This is a Seventh-day Adventist church. The movement was founded after the Millerite movement in 1844. One of the early Adventist founders emphasized the importance of health as early as 1863, and as a result, many Seventh-day Adventists have been, over the years, vegetarian, abstaining from alcohol and drugs, and also participating in exercise and activity, with the principle that our bodies is the temple of the Holy Spirit of God, and therefore we should take care of it. So we definitely avoid unclean meats and encourage a vegetarian lifestyle. And maybe you didn't know, but Seventh-day Adventists run the largest Protestant not-for-profit healthcare system around the world, over 2,000 different clinics and medical centers around the world. And they're recognized to outlive the average Californian by 10 to 14 years. This is real life, and it's important. So I'm just going to really quickly go through what he had in his book. Some of it we've already talked about, so we'll highlight it very quickly. But one of the conclusions that he had that left an impression on me, that is, if you want to make it more likely to live to be 100, then you should live like a Seventh-day Adventist. And so I'm going to go through the principles that he highlighted about Seventh-day Adventists. So Adventists have healthy BMIs, meaning they're more likely than the average population to maintain their body weight. And as a result, especially the ones that are active and eat meat sparingly or not at all, they have much lower blood pressures, lower blood cholesterol, less heart disease risk, and than their counterparts who are heavier, which is typical of America. And we'll show you a little bit about this. So over the last 20 years, our country has been turning red, meaning that there is over 30% of the population that are now in the obese range. And this doesn't just affect adults in America, it's an epidemic in colleges, in high schools, and even in elementary schools. We have an epidemic of obesity, not just loneliness. And so the second principle that he talked about was get regular moderate exercise. I'm not going to belabor this because we just talked about that with Dr. Ben. But the Adventist Health Study that studied over 100,000 Seventh-day Adventists says you don't need to be a marathoner to maximize your life expectancy. Just getting regular, low-intensity exercise like what we talked about, daily walks, walking a 5K like they're going to do tomorrow morning, markedly reduces your risk for heart disease. Again, our country isn't quite as bad as the obesity grid, but a large percent do little or no exercise. And this is also associated with obesity. My wife likes to quote Isaac Newton, "A body in motion tends to stay in motion unless acted on by an outside force." I think that's one of the laws of thermodynamics, but it also applies to our health. If you stay active, you're more likely to remain active. And so it's important to put this into principle. And so why exercise? We've already talked about this in our previous slide, but exercise can be a stronger risk factor for heart disease than even smoking. And obesity is associated with lack of exercise. Physical inactivity is a modifiable risk factor, and it also ties in with social isolation. All right, third principle is what we're talking about this weekend. Spend time with like-minded friends. So Adventists tend to spend time in community with other Adventists and with other people who are into healthy lifestyle and into service. So you're more likely to be engaged in community. It tends to add to the possibility that you will live to be 100 years old. They find well-being by sharing their values and supporting each other's habits. And Dr. Jason talked about that this morning. Definitely significant. Something that's interesting that comes out of the Adventist Health Study is that by eating nuts at least 5 times a week, it reduces your risk for heart attack, for stroke, by nearly half. And so at least 4 major studies now have confirmed that eating nuts, reducing your reliance on meats, using more nuts in your diet can have a benefit to your health. The 5th principle is giving something back. So part of living in a community is that you can help serve other people and be of service to other people. And so, like many faiths, Seventh-day Adventists encourage and provide opportunities for its members to volunteer. People like the centurion over on the right is Marge Judson. She's over 100 years old, and yet she likes to go visit people in the nursing home. Ironically, most of them are much younger than she is. And Dr. Ellsworth Wareham was a fixture at medical school when I was at Loma Linda over 40 years ago, 38 years ago. He was a cardiothoracic surgeon. He lived to be 104 years old. He just died a few years ago, but what's interesting is that he continued to practice cardiothoracic surgery, do open heart surgery until the age of 95 years old. So we're not talking about just living 10 more years. We're talking about healthy, contributing years, being active and being able to do things because you're avoiding many chronic diseases, including what I'm interested in, which is heart disease. Uh-oh, I went too far. So there's also, in his book, he recognized that you should emphasize eating most of your calories earlier in the day, and that's the opposite of what many, many cultures around the world do. I was just recently in Libya, and it's warm Middle Eastern hospitality type of culture, but we didn't start eating until about 10 o'clock at night for the biggest meal of the day, and dessert didn't come out until midnight. And so it's definitely a cultural community experience, but it takes up half the night to eat. So if you want to eat like a Seventh-day Adventist, it would be better to eat the largest portion of your meal, eat breakfast like a king, lunch like a prince, and dinner like a pauper. And so it's a complete opposite of what our culture typically does, where we eat our biggest meal right before we go to bed. Then we don't have any time to exercise. We don't have time to burn it away. And so it would help to do that. Another principle that he identified in his book is to take a sanctuary in time, to come apart in a community. And so it's recognizing that God originally created the world in 6 days, and on the 7th day he rested and made that as a Sabbath, a time to just set things aside from our daily work and get together. Get together outdoors in nature, get together around food, get together in worship. And so this is something very important to Adventists, and particularly the group that lives generally to be 100. So what we're going to really focus on now is diet. Rarely, Seventh-day Adventists rarely eat meat or animal products. And so the ones that follow a vegetarian diet, this was looked at by a National Institute of Health study with over 100,000 Seventh-day Adventists, predominantly in California, who were compared to their peers. In doing that, had dramatically reduced risks of heart disease, dramatically reduced risks of stroke, dramatically reduced risks of cancer. And we'll look at that in a little more detail. But in the Adventist Health Study, it showed that consuming fruits, vegetables, and whole grains seems to be protective against a wide variety of cancers. Now, we're used to looking at foods, alcohol, drugs, and things as being harmful. We don't really think of our food as being beneficial. But this really makes the case that our food, the foods we eat, can be our best medicine. It can actually prevent heart disease, prevent cancer, and that was demonstrated in the Adventist Health Study. And so if you're going to eat meat, it should be a little tiny portion on your plate, which is more typical of the Mediterranean diet, where it features fruits, grains, vegetables, and maybe a little bit of meat, but it shouldn't be the main thing on the plate like the typical American diet. So what is the connection between meat and cancer? How strong is the evidence? And this is from the World Health Organization, looking at particularly processed meats, so things like sausages, bacon, salami, bologna, things that are processed meats. The evidence is so strong that it causes cancer that it has a type 1 group of evidence, meaning it's overwhelming. The evidence for processed meats causing cancer is just as strong as the evidence for smoking. And so very, very strong. There's 2A recommendation, 2A probability that eating red meats, so pork and beef and lamb, this doesn't include chicken or fish, so the flank meats of mammals essentially, has a 2A evidence that it also is very likely to cause cancer. So processed foods, there's no doubt about it. Processed meats in particular are known to be carcinogenic, and red meats are likely to be carcinogenic. And then other meats, such as poultry, may be associated, but that's not quite so strongly associated. So one of the little mechanisms that I'll go into in a little bit of detail is a substance called TMAO, trimethylamine oxide. How many of you have ever heard of TMAO? Yeah, about 4 of you. So there are probably a lot of substances like this, but recently in the last 5 years, trimethylamine oxide has been extensively studied, particularly by doctors up at the Cleveland Clinic in my home state of Ohio. And they've been studying this substance, and they have found that it is a potent mediator of inflammation. Inflammation can set us up for cancer, for heart disease, for stroke. They were particularly looking for the risks associated with vascular disease. And so elevated levels of plasma trimethylamine oxide is linked to inflammation, increased risk for heart disease, and the increased tendency to make blood clots that can lead to a heart attack. And so the way that you get TMAO in your bloodstream is very interesting. So it turns out that TMAO, I don't know if I have a laser pointer, I don't, but up at the top, different proteins like choline and carnitine, which come from animal products, even from egg yolks, but especially from red meats. Carnitine, choline get absorbed in our bowel, but it turns out that the bacteria in our gut, there's this microbiome, billions and trillions of little bacteria in our guts. It turns out that they metabolize these animal proteins and turn them into trimethylamine. Trimethylamine by itself is not a problem, but then that gets absorbed through the gut, gets oxidized in the liver, and it becomes very important inflammatory mediator. So it can lead to type 2 diabetes. It can contribute to the metabolic syndrome. It can contribute to heart attacks, to atherosclerosis, and even chronic kidney disease. And so it's a potent inflammatory mediator. Now, there are literally hundreds of inflammatory mediators. When the Cleveland Clinic first wanted to study this, they turned to a group of 20 vegetarians, vegan vegetarians, and said, hey, we want to study the effects of trimethylamine oxide. We want you to eat a hamburger every day, and we want to study this for 20 days and see what the effect is and how we can measure it. They couldn't find 20 vegans that were willing to eat a hamburger 20 days for the study, so they wound up giving them choline capsules instead. And what's really curious about this is when a vegan vegetarian ate the choline capsules, for over 2 weeks, there was no measurable level of TMAO in their bloodstream, meaning their gut bacteria weren't able to digest it and recognize it because they were lacking the type of bacteria that transform choline and carnitine into a toxic metabolite. But after about 3 weeks, they started getting some elevated levels. Now, when they gave the same capsules to people that were on a standard American diet, in less than 12 hours, they had detectable levels of trimethylamine oxide. And so it just kind of shows you that the bacteria in our bowels can change based on the type of diet we eat. And the bacteria in our diet, if you're on a vegetarian diet, is much more likely to be digesting fiber and cellulose and less likely to be used to digesting meats, and it doesn't produce the same toxic chemicals. So Americans are obsessed with getting enough protein. It's always been assumed, oh, well, the best protein is meat protein. We don't have time today, but there are many high-performing athletes that perform at their peak. One notable one, Tom Brady, was quarterback with the Patriots and was able to perform into his 40s. And he attributes that to being on a plant-based diet and contributes that to recovering quicker after workouts. So the reality is we are actually starving for fiber. We are starving for plants and for plant-based sources. So number 9 in Dan Butner's book, The Blue Zones, is to put more plants in your diet. And this is in support of the biblical diet given in Genesis chapter 1 of adding grains, fruits, nuts, and vegetables. And so God said, I will give you every herb-bearing seed which is upon the face of the earth, and every tree in which is the fruit of a tree yielding seed. To you it shall be for meat. And so Adventists encourage a well-balanced diet that includes nuts, fruits, legumes, low in sugar, low in salt, and especially low in refined grains. So all carbs aren't created equally. There are good carbs and there are bad carbs, but the reality is we are made to eat complex carbohydrates predominantly. Our diet doesn't need to be made up of predominantly protein. Studies show that non-smoking Adventists who ate 2 or more servings of fruit per day had about 70% fewer lung cancers than non-smokers who ate fruit once or twice a week. Adventists who ate legumes, such as peas or beans, 3 times a week had a 30 to 40% reduction in colon cancer. And a new study has found that adherence to this way of life had the nation's lowest rates of heart disease, diabetes, and obesity. And so there are huge benefits to eating this way. So what does a typical Loma Linda centenarian, people that make it to 100, eat? How do they eat? Where do they get their calories? Well, it turns out that 27% come from fruits and 33% come from vegetables. 12% come from legumes. Very little comes from meat and poultry. 7% comes from whole grain and about 10% from dairy. And so that would be a typical diet. We've already talked about that carbs are not created equal. You cannot compare super sugar smacks to kale or cabbage or broccoli. They're not in the same category. And so if we're eating the things that we can grow, that would be the very best. So what do plants do? Plants are foods that actually protect us against cardiovascular risk factors. And so they reduce or they replace, first of all, they replace the foods that are high in fats. And they reduce LDL oxidation. They improve the endothelial function, the little lining of our bloodstream, of the little kind of the lining of our blood arteries. It improves the function so they can react and constrict normally. It reduces inflammation. So very powerful at reducing inflammation, and it alters the gut microbiome that we've already talked about. It lowers our blood pressure, it raises the potassium levels, and it decreases our lipids, and actually helps with the balance between the good cholesterol and the bad cholesterol. So plants are very beneficial. Whole grains actually lower your diabetes risk, especially eating like cereal fiber. And it improves the postprandial glucose response. It lowers our caloric density. It increases satiety, and it's also metabolized by the gut bacteria to form short-chain fatty acids. Short-chain fatty acids have the benefits of reducing the inflammation that's in our bloodstream. Improves how our mitochondria functions. It decreases inflammation. It improves our sensitivity to insulin, making it less likely that we will be diabetic. And so randomized trials show that the closer you get to a full plant-based diet, the better your cholesterol levels are, your blood pressure is, and your risk for heart disease. Fiber is not just to prevent constipation. And so we need fiber. We need whole grains. We've already talked about all the benefits. So a commentator on foods that I really appreciate, Michael Pollan, says, eat food, not too much, and mostly plants. That is really summing up what the best diet that leads to living to be 100. Number 10 is to drink plenty of water. Americans don't get enough water. We drink sugar-sweetened beverages or alcohol, but pure water is the very best way to drink. And if you drink 6 glasses of water per day, you reduce your risk for a heart attack nearly 60 to 70%. So God said, I give you every seed-bearing plant on the face of the whole earth, every tree that has fruit with seed in it, that will be your food. That was the original diet that God gave back in the book of Genesis. So the other thing is to be a part of a community. And as we close, 1 Corinthians 10 says, therefore, whether you eat or drink or whatever you do, do all to the glory of God. God wants to be in community with us. We're not just to be completely isolated. And as talking about social isolation, it's strongly linked to poor diets. People that are alone tend to either not eat very healthy at all and don't eat regular meals, or to quell the pain of isolation, they overeat and they eat a lot of junk food. And so there's emotional eating to try to fill the social void. And so you can very likely suffer from nutritional deficiencies, vitamin deficiencies. So what about social isolation and the risk on heart disease? We've already kind of talked about this. It's come up at every single presentation since last night. But social isolation and loneliness are major overlooked risk factors for heart disease. I don't screen for this enough in my patients, but they increase the risk of heart disease and stroke 29 and 32%. And so by being part of a community, we can dramatically reduce our risk for a heart attack, for a stroke, for other things. Biologic mechanisms, social isolation actually increases inflammation. It increases oxidative stress. It activates the sympathetic nervous system, which can raise your blood pressure and cause lots of problems, and it leads to poor cardiovascular health. Social isolation is associated with a 60 to 70% higher risk of death over 7 years. So 60% increased risk of dying if you're living an isolated life. What about family meal times? This has largely gone away in America as well because of fast foods and because of running all over the place with the kids, that families don't get together and eat anymore. But over the last 20 years, there's been multiple studies that show that particularly eating together as a family provides significant benefits to nutrition, which leads to improved mental health, better academic achievement, stronger family bonds, higher. These meals are kind of a protective factor. It makes it less likely. If you eat in a group where you have time to talk with each other, you're less likely to overeat. You're more likely to get the satiety factor kicking in so that you stop eating as opposed to just eating quickly by yourself. And so there's less risk of substance abuse in teenagers who have meals with their family. And so what about shared meals? So improved nutrition, we've talked about. Shared meals typically include more fruits, more vegetables, and more fiber. So when people come together and share their food, there's more variety, and you're tending to get more vegetables, more fruits, more whole grains. When you share a meal, there's mental and emotional health improvements. Adolescents who share meals regularly have lower rates of depression and anxiety. It also boosts their self-esteem and it increases their resilience. They can bounce back from traumatic experiences better. And they tend to do 40% more likely to get A's and B's if your family eats together and your kids have a social time eating together. Stronger bonds and lower obesity rates. So I'm going to close with this slide, but Jesus said in John 10:10, I have come that they may have life and that they may have it more abundantly. That is the conclusion of eating healthy, eating to God's glory, and being part of a community. Thank you.
Thank you, Dr. Schwartz. Thank you. All right. So on that note, we will be serving lunch today where we can eat as a community. So don't just run to your car and leave. We have food that's prepared. And best of all, it's free. Yeah. Okay. Okay, maybe the best part is that it's healthy too, but yes, it's free as well. Okay, so we're going to make a small adjustment to our program because, as I noted earlier, as you noted, we're a little bit off our time. It's okay. We are going to be delaying our Q&A session. We're going to combine it with this afternoon's Q&A session. So this afternoon's Q&A session was supposed to be 20 minutes. We're going to extend this afternoon's so that we can spend more time with the questions, which QR code is up there if you have it. So that's also going to be an encouragement for you to come back again or stay. Don't even come back. Don't even leave. You don't have to leave. You don't need to leave. Just stay, hang out, and get involved with community after lunch, and then we'll come back and we will start our sessions, okay? So at this particular time, what we're going to do is going to take, again, a little 5 to 7 minute break or so, and then after that, we'll come back and you will hear from Pastor Tony Anobile, all right? So let's take a quick break. Again, bathrooms are out, and if you don't need to go to the restroom, you can keep practicing that thing where we meet new people and we thrive in community. Okay. Got the blood flowing again. Hopefully you were able to meet someone new. It's hard for me to meet new people necessarily because I kind of know everybody already, except for you. I don't know you just yet. How you doing? AJ's the name. How you doing? AJ, sorry, I have cold hands but a warm heart. Oh, your son, there you go. All right. Ah, you're a doctor too? Everybody's a doctor around here, huh? Oh, you're a doctor. Listen, I'm a doctor in my own mind. All right. As we get back to our seats, I met someone new this morning. So that actually 2 people. I met you as well. Very good. I met MJ last night. Yes, indeed. So let's go ahead and get started again. You can go ahead and turn my music down, please. Again, we have the QR code for if you have any questions. We have had 3 dynamic speakers this morning. I have been just really enjoyed the presentations. It's been really good. And we have more to come. As I had stated, I would like to remind you we're going to move some things around. We're going to move our Q&A session just to the afternoon, and we're going to extend that. So if you have questions, A, you'll have to come back, but B, don't worry, we are going to do it, okay? So with that being said, I would like to bring up our next speaker. He is a pastor, Pastor Tony Anobile. He puts many miles on his car. But Pastor, just like I was doing the rest of the speakers, since you're going to be up here, I will do the same for you as well, which is we want to just get to know you for a second.
Okay.
So I'm going to ask you a couple of questions.
Sure.
Not sure how long you were here, but did you hear Dr. Ben's favorite food?
I did.
You did. Do you know what that is?
I know what it is.
Yeah, you did? Okay. That was a first for me. Okay. And you heard Dr. Brian's favorite food as well?
Yep.
Yes, indeed. So now, same question.
All right.
Do you have a favorite food?
Well, I'm Italian.
Okay.
And
right up my alley here. Here we go.
Nothing better than a great salad. So we have salads all the time at home.
Come on,
Love
man.
a good salad.
I thought you set me up for that one.
You can add the pasta and the rest. And then I studied in Montemorelos, Mexico, so I love Mexican food. That's my second favorite.
Okay. You set me up with the whole thing. Okay. Anything else that you'd like to share with us about anything that's going on in your life, something personal that you're proud of, anything that we just get to know you a little bit better?
Proud of my family. We're all together in Texas, in the Dallas area. You know Tony Jr.
Yes.
He sends his love and hellos. He's at Fort Worth First. My youngest son just became the senior pastor of the Burleson Church.
Oh, my goodness.
Which is next door to the Union office, so I get to see my grandkids all the time, and that is a blessing.
You guys are infiltrating the whole
we are.
DFW area
we're
there.
taking over, yeah.
Very good. Is your wife going to take over a church next too? No?
She's teaching now, or she works at the university.
Oh, his wife said,
Yeah.
well, you guys are
Yeah,
everywhere.
no, yeah,
Okay,
yeah.
very good. One last question.
Sure.
Before you go, is there anything that you're afraid of?
Oh, wow, spiders.
Spiders, very good. All right, without further ado, Pastor Tony Anobile.
Thank you very much. Good morning and happy Sabbath. So I am not a doctor. I have been very blessed and impressed by the seminars, but sometimes out of respect, especially in the Spanish community, they'll introduce me as Dr. Anobile. And the first thing I say when I get up is, I hope nobody's sick, because if you are, you're in trouble if I'm here. But it's a joy to be with you. I am grateful to be here. I was here 2 years ago when I thank Dr. Prince and Pastor Vitale for the invitation, and just excited about health. And as I was talking to Pastor Vitale about community involvement, and that's kind of where we can all get involved. I think everything we've heard, in fact, I've been taking pictures and sending slides to my family, particularly my youngest son who has the 2 grandkids, 3 and 1, and I was saying, family time. You know, we get away from that. I appreciate what the doctors have shared. I am going to be 63 in May, and I am one of those that my best friend was the outside wall. because I played outside every day. I was the one that they had to say, you got to come in now. I remember being at a workers' meeting, and we were playing baseball, softball, and I was with a pastor my age and with a few young people, and the ball was hit to a person, one of the young people, and the ball just dropped. And the pastor said to me, he must be into some other sports. And I said, yeah, it's this one. So anyway, I appreciate everything that I've been hearing, but when we talk about what can we do as a church, the other day at the union office, and I have the privilege of working in the union office, at least I do today. Tomorrow's our constituency session, Pastor Vitale, so I may not be working there after tomorrow, but I am today. And the education director, Dr. Carol Campbell, gave worship the other day, and she was talking about mission. And we're going to focus a little bit on mission. And she said, every organization needs to decide what their mission is. Why do you exist? So as a church here at Scenic Hills, why do we exist? I would suggest to you that the reason we exist is to tell as many people as we can, starting with our family and our community, about Jesus and that he's coming back to take us home. And to get people ready, and as we've heard already this morning, to live an abundant life now. So what I like about this is that everybody can tell their story. I remember one time I was at a pastor's meeting, and we, at camp meeting actually, and we always had doctors give health lectures, and they would come to the pastors in the morning. I'll never forget one time, one of the doctors, and I was president at the time, and I remember thinking, this is something I can do. He said, now listen, I can sit here and tell you a bunch of stuff to do and not doing this, but just walk 30 minutes a day. Just do that. And I remember thinking, I can do that. And I started walking, and it's incredible just walking 30 minutes a day, what it does for your health. Well, to me, this is the same thing. We can all tell our story. You don't have to preach. You don't have to sing. You don't have to give seminars, but you can all tell your story. People love to hear your story. That's what we're going to talk about today in the brief time that we have. So, who is a missionary? Number one, it's someone who fulfills the mission. What is the mission? To talk about what Jesus has done in your life. So I'm the spiritual component of the conference, and included with everything that you've heard medically, which is absolutely phenomenal today. But a missionary fulfills a mission. What is it? Someone who discovers the love of his life and cannot be silent. So I want you to think about that. What has Jesus done in your life? A lot of us become pew warmers, and I am here to challenge you today to not do that anymore. I believe Jesus is coming back very soon. I am excited to be, and I love every denomination, and I'm grateful for that, but as a Seventh-day Adventist, I am excited that, number one, we believe that God gave us a day of rest, and as you've heard, they've done studies. In fact, there's a beautiful YouTube video by a non-Adventist pastor who's done a study, and yes, you know that, and Adventists live 11 years longer than the average American, and when you do the math, we have 11 years of Sabbaths in our lives. So we rest, but number two, we believe that Jesus is coming back soon to take us home. So once I know that, and I'm excited about it, I can't keep it to myself. In fact, when I'm speaking at other churches, and I'll say it here too, when I was in my 20s, 30s, 40s, I had a bunch of goals, a bunch of plans. I am now reducing my request to God to one thing. For me, I want to be in heaven with my family. I want to spend an eternity with my kids, with my grandkids, with my family. And as we've heard already, family is anyone who's engaged, so I want to spend it with all of you. And once I know that, I cannot be silent. Number three, someone who must share what he has discovered. How can you keep it to yourself? I had a neighbor when we lived in California, and when we were transitioning to Arizona, he came over and he knocked on the door and he said, Pastor, I just want to say, I want to thank you because you never shoved it down my throat. That was the phrase he used. And at first I said, I'm a good neighbor. But then the more I thought about it, the more it bothered me. What if when we get to heaven, he's there and he grabs me in those 10 minutes when we can be angry at somebody before we're happy for the rest of our lives, and says to me, you know why I'm here? Not because of you, but because somebody else. Hey, Naseem, good to see you, my friend. Not because of you, but because somebody else took time to tell me about Jesus. Well, I don't want that to be me. So a missionary, and we're talking about our community, and this is something everybody can do, from all the young people that are here, the youngest child to the oldest adult, is tell your story. If Jesus has done something for you today, the 25th of April, 2026, God will put somebody in your path for you to share your story the way God has gifted you to share it. Now, Desire of Ages says, a book by Ellen White, every true disciple is born into the kingdom of God. As a missionary, he drinks of the living water, becomes a fountain of life. The receiver becomes the giver. You can't keep it. You've got to give that which God has given you. But let's talk about what a missionary is not. The mission is not to proselytize. And by the way, this is by Alejandro Bullon. If you know Hispanics, for sure will know Alejandro Bullon, a very good friend of mine, who's probably one of the most renowned, known evangelists in the Seventh-day Adventist Church. He has spoken in theaters of 100,000 at a time, okay? This is an expert, and this is what he says. The mission is not to proselytize. It is not an attempt to have people leave their church and join another. It is not trying to change people from one religion to another, rather to change their lives. Being in the church is the natural result of having a life change. People who at one point had their lives and homes destroyed, that did not know what to do or where to turn, that spent entire nights without sleeping because of the emptiness inside, who one day found Jesus. They cannot remain silent. That's what I want to emphasize to you today. And some of you are going to say, Pastor, I'm an introvert, I'm shy. I am too, believe it or not. But I'm saying, folks, it's time to come out of our comfort zone. And it's not about getting another degree, but whatever God's gifted you to do, how he's gifted you to do it, do it. Don't keep silent. All I can do is pray. Well, then pray every day for your neighbors. I can't leave the house. You don't need to leave the house. I don't like to speak in public. You don't have to speak in public. But you can tell your neighbor to have a good day. When you're in the line, you can tell the person, can I help you? Or if you have a whole card and they've got 3 items, let him or her go ahead of you. All of us can do that. Whatever it is, do not remain silent. They go out and share what has happened to them. It's a compulsion founded on love. It is a motivation that springs out of a new perspective on life. So, I love this. You know it. You've heard it. We're going to review it today and spend the rest of our time with this. Christ's method alone will give true success in reaching the people. The Savior mingled with men as one who desired their good. He showed his sympathy for them, ministered to their needs, and won their confidence. Then he bade them, follow me. There's a whole lot I could say about this, and I'm going to, but in tying in with the Gospel Commission, the Seventh-day Adventist Church in North America right now, the NAD, is focusing on 50,000 small groups in the next 5-year period. We just got back from meetings. And here's the thing. When we talk about Christ's method alone, it's taking time to spend with people on a one-on-one and get to know them and get to share Jesus and then bring them in. The Gospel Commission says, Jesus said, therefore what? Come on, you know it. Therefore, go. And then he said 3 things. Now, I sometimes forget my notes. One time I was in Nicaragua and I was preaching and the wind came and blew all my notes away and I had to wing it. Some of the stuff came out right, some of it didn't. But Jesus never winged it. He never got the order confused. So when he gave the Great Commission, he gave 3 important things. Therefore, go. And number 1, what? Make disciples. That's number one. Number two, baptize. And number three, teach them to obey. Now, I want you to listen to how most of you said, number one, teach. I'll be honest, if you're a visitor to the Seventh-day Adventist Church, I'm going to confess, we were great 20, 30 years ago about teaching. We indoctrinated. Then we baptized. And then we hoped people would become disciples. Jesus said the opposite. Make disciples first, then baptize, and then continue teaching them all the things that I have taught. The speaker of Breath of Life, Elder Snare, I love the way Elder Snell says it. Baptism is enrollment, not graduation. Okay? You don't have to know everything before you're baptized. Well, so let's get into this, because to me this is huge and it ties in. Number one, Christ's method alone. He mingled with men as one who desired their good. So we've already heard about it. He mingled. He was in the community. I've been asked as a pastor, can you name 5 friends that aren't Adventists? And for some of us, it's hard to do that because we are part of, and we're sheltered. But I'm telling you folks, our role, our mission is to tell others about Jesus. And we can't do that when we spend time only with ourselves. Christ mingled as one who desired their good. Jesus did not approach people as one who wanted to bring them to church. Instead, he approached them as one who wanted to help them. I will tell you something. I am Italian, German, type A. My kids, if Tony Jr. were here, my other kids, they would say, Dad, this, and that. I am praying that I will be able to see people the way Jesus saw them. Can you imagine how different the world would be if we saw people the way Jesus always saw them? As one who desired their good. Now, come on, be honest, church. Some people, you see them, you don't desire their good. Some of us are still holding grudges with people that have done stuff to us. Some of us already prejudge. I love, as the doctors were sharing, I remember, back in Arizona, I would go to, I'm cheap, so I'd go to Supercuts or whatever the other one is. And, you get there and you sign in, and then I'd always start looking to see who, and there was this one young lady, all tattooed, piercings everywhere. And I said, oh, Lord in heaven, whatever you do, I don't ask for a lot, God. Please don't let her be the one that cuts my hair. I had a speaking appointment the next day, and I don't know. So you start looking, and they start sweeping, and you start, oh, how many people are ahead of you? And sure enough, because see, God goes, oh, really? Oh, really? Watch this. All of a sudden, she finished, and she gets, Tony? And we sat there and go, not too much, just a trim. We started talking. That she was a mother of 3, probably more conservative than me. And by the end of our conversation, she and I, had we lived together or close by, would become great friends. She's someone I wouldn't mind, other than her appearance, tattoos and stuff, that I had to get used to. It's okay. I would want her, I would trust my kids with her. But not when I saw her right off the bat. I couldn't wait I wanted to get as far away from her. And we do that to people. But Jesus saw everybody as a child of God and desired their good. He wanted to help them. Every time you approach a family member, friend, neighbor, or workmate that person already knows you are a believer who is going to try to convince them of your convictions. So they're already at the defensive, ready to contradict your arguments or avoid you altogether. So they don't have to have that conversation with you. I know when I visit my family that aren't Adventists, and it took a while, they thought I was a cult. Some still think I'm in a cult, and it's taken years to break that down, but it's true. But if I approach people as someone who wants their good and genuinely desires their good, They're going to be more open as we keep going. Jesus talked to people about what was of interest to them. He related to people as one who desired their good. Every human being appreciates being made to feel good. Who doesn't like to have someone ask them about what they're interested in? And what are human beings interested in? Sports, finance, culture, fun, activities, family, not religion. Therefore, talk to them about what interests them. Don't bring up religion or the Bible, or for sure avoid talking about fundamental beliefs. If you do, you will, now listen, you will most certainly fail, not because the ground is infertile or because the secular mind is too tough. It's because the approach was not correct. Now, before you get mad at me, remember, this is a process. So let me finish the whole thing before you go, oh, what are you talking about? Heresy. No. In fact, Pastor Bouillon used to do this. How many of you want to stop being a Seventh-day Adventist? In 2019, I traveled 38 days with him, and we would go to every church every day. How many of you want to stop being a Seventh-day Adventist? Nobody raised their hand. And then he would say, why do you think your neighbor is going to want to stop being a Baptist or whatever? It's not about that. So don't knock on the door and say, the person you're following is the beast, and here's a poster to prove it. Okay, now, is that a part of the process? Sure. There's going to come a time where we're going to talk about Daniel and Revelation and the importance, but he's saying, and I agree, don't start with that. My neighbor was Vietnamese, and we had nothing in common. In fact, they would have parties every weekend, loud blaring music, alcohol all over the place. There was a rule in Gilbert, Arizona, that you could not have trash in bags, or even if you had them in your trash can, it could not even be a little open. It had to be completely closed, or they wouldn't pick it up. Well, when we moved in, we had 2 trash cans. We didn't usually use both of them, so I would routinely ask him, do you need to borrow my trash can? And he said, oh, that would be great. So there's my trash can full of beer bottles and alcohol. Great for a conference president, right, if someone takes a picture. But you know what? We became friends. Now, at no point in our friendship did I say, by the way, you know, the religion you follow is wrong, and you know where you're going. See, because that's not what it's about. That's not the mission. Talk to them about what they like. Therefore, talk to them about what interests them. Don't bring up, okay, because that will for sure put you apart from them. All right, let's keep going. Jesus said that we would be fishers of men. Have you ever fished before? I have not, so I don't know, but I hear it's fun. What do you use for bait? Chocolate ice cream? Probably the wrong thing to bring up at a health conference, but you know what I'm talking about. I have no doubt that you truly like those, but the fish does not. Fish eats worms, so that's what you use as bait. Why then don't we use the same thing when we are trying to bring someone to Christ? I don't believe you eat worms, but you put worms on your fish hook so you can catch fish, even though the worm may seem repulsive and unclean. Now, someone says, well, so like go to a bar with them? No. You don't compromise your principles, but you meet people where they are. Read the Gospels. Jesus always met people where they were, always. But he didn't leave them there. He said, now that we're friends, there's a better way to live. Follow me and I'll show you. Don't live that. What did he tell the woman caught in adultery? Where are your accusers? And she looked at they aren't, and I don't either. But listen, don't do this anymore. You're way more valuable than that. And the Holy Spirit took that woman where she needed to go. Our job is not to convict people. Our job is to take them to Jesus. The Holy Spirit does the rest. And so that the pressure's off. You and I just need to tell our story that Jesus loves them and that he's coming back to save them, and then the Holy Spirit will do the rest. Jesus saw in every soul one to whom must be given the call to his kingdom. He reached the hearts of the people by going among them. As one who desired their good, he sought them out. How often do we seek out our neighbors, our community? Do you have a list of people you pray for every day that you're hoping the Holy Spirit will convict? Maybe it's a family member. Maybe it's a son, a daughter, a grandchild. You know who it is, but Jesus sought them out in public streets and private houses, on boats, synagogues, by the shores of the lake, and at the marriage feast. He met them at their daily vocations and manifested an interest in their secular affairs. He carried his instruction into the household, bringing families in their own homes under the influence of his divine presence. His strong personal sympathy helped to win hearts. Number 2, he showed his sympathy for them. My brothers and sisters, visit those who live near you. Visit. We don't do that a lot anymore. And by sympathy and kindness, seek to reach their hearts. Be sure to work in a way that will remove prejudice instead of creating it. You know the comical sayings about some of us when we get to heaven, that the Adventists are going to have their own private section in heaven because we think we're the only ones that are going to be there. And sometimes we act like that. Now, do I believe that we're a movement? Sure. Do I believe that we're God's remnant? Yes. Does that make me better than anybody else? No. And Jesus, when he talked to people, never created prejudice, he removed it. And remember that those who know the truth for this time and yet confine their efforts to their own churches, refusing to work for their unconverted neighbors, will be called into account for unfulfilled duties. Again, folks, it's about telling your story. You don't have to ask for special gifts or anything. Just tell your story. Share how good God has been to you, to your family. That's all you have to do. But be willing to do that. Take a risk. Watch what happens. 3 steps. Number 1, all right, let's see if we can get this to go the way. So, 3 steps. There are 3 steps, I promise. Maybe they're not going to come up. But let's keep going then. Number 3, he ministered to their needs. The 3rd step is crucial. Humans are moved by need. When a commercial wants to sell something, it appeals to the need. The key to marketing is the needs of the people. In almost every community, there are large numbers who will not listen to the teaching of God's word or attend any religious service. If they're to be reached by the gospel, it must be carried to their homes. Often the relief of their physical needs is the only avenue by which they can be approached. We learned something during COVID. It was very interesting. We learned that a lot of people connect to, in our case, the Seventh-day Adventist Church through social media. It was amazing. I had people calling me saying, Pastor, you know what? I never thought prophecies could be fulfilled quickly, but after COVID, I can see how they will. And this is their evangelistic fear. So just in case, I'm going to pay tithe. I'm not suggesting that's a great evangelistic tool just in case to scare people. No. But what was interesting is they said, I'll never come to church, but when we took time to reach out and visit them, and that's why the small groups concept, which is the biblical concept, is so important, because we're talking and reaching people where they are. Sometimes it's not even talking about religion at all. It's about what can I do to help you? What do you need me to do for you? And when we help with their physical needs, they can be approached. But that's not all. But people don't only have physical needs, so we must not only care for their physical needs, we must also be aware of their emotional needs. And we don't have time today to go into EQ at all. But it's a huge thing. The world is full of people that are sad, living horrible dramas in their homes with their spouses, with their children. Desperate people who cannot sleep at night. People who do not know where to go, who to turn to. They ignore that Jesus is the answer. Therefore, get close to them with a willingness to listen and extend a helping hand. Now look at this. Simply what? Listen. Parents, you know this. We're already thinking about the answer before we've even heard the whole conversation. Pastors, we do that too. I can't tell you how many times I would have people in my office say, Pastor, I've got a problem. And I go, And they start talking, I go, tell me more. And I said nothing, and they go, man, thank you. Your answer was phenomenal. I never said a word. I simply listened. There are many people who pay thousands of dollars to a psychoanalyst just to have them listen. We need to listen to them, be genuinely interested in their concerns. They need to know that they can count on us no matter what. Number 4, Jesus won their confidence. The key word here is confidence. You don't trust someone you don't know. Is that true? It's true. You don't trust someone you don't know. Many fail in their attempts to bring people to Jesus because they have not won their confidence. We go from A to Q and we try to skip everything, and you can't do that before asking them to follow Jesus. When you have won someone's confidence, when you've won someone's confidence, the heart is no longer hardened. No one resists genuine love reflected in a true child of God. 100% of the time, no one rejects genuine love. That's why I love this quote from Ministry of Healing. Christ's method alone, because Christ was genuinely interested in people. And I pray for that because I'm not. But I want to get there so bad. I want to be that kind of person that says, no matter what's going on, no matter what you are, no matter where you've been, I can see how Jesus loves you. In Christ-like sympathy, we should come close to men and women individually and seek to awaken their interest in the greater things of eternal life. Their hearts may be as hard as a beaten highway, and apparently it may be useless effort to present the Savior to them. But while logic may fail to move, the argument be powerless to convince, okay? Effort useless, argument useless. The love of Christ revealed in personal ministry may soften the stony heart so that the seed of truth can take root. Love that. And we must invest time. It isn't going to happen in 3 minutes or in a text once. We have to invest time. Pastor, and we already heard, life in the fasting, we're all so busy. We are busy. That's part of the problem. We need to invest time. Right now, think of 5 people in your community that maybe you can reach, that you can talk to, that you can serve their needs. Number 5, then he bade them follow me. How do we accomplish this? We must turn to prayer. Look at this. You have been praying every day for that person you want to bring to Jesus, days, weeks, sometimes months, even years. Do not get discouraged. God has his timing, and his timing is always right. Amen. Even though it may seem like nothing is happening, God is at work. Just keep praying and cultivating a friendship with that person. You hang in there. You tell your story. You share with people what God has done to you. And let the Holy Spirit, because that's the Holy Spirit's job, is to convict that person. Our job is to bring them to Jesus. Well, I guess it's telling me it's time to stop. Oh, there it is. Let's see if we can go back just one slide. Okay, no one can resist such a situation. Even the most stubborn unbeliever will be moved. You are not talking about religion. You are simply praying for that person, making time to be his friend, talking about things of interest to them, meeting their needs, showing them sympathy, gaining his confidence, and now let him know that you value and are praying for them. And most times your neighbors are going through crisis just like you are. And who doesn't appreciate when they say, Pastor, I'm going to pray for you? You know, I get texts, Pastor, I'm praying for you. As we get ready for our session tomorrow, I got text today, Pastor, I'm praying for you. What a wonderful feeling. Who doesn't like that? No one can resist the attraction of genuine love. Love begets love. Christ's method does not fail. If you follow Jesus' example, you too will have the success that he had. Even if you're confronted with hardened hearts and secular minds, the divine prophetic affirmation is Christ's method alone will give true success in reaching the people. Of course, it does not dismiss other evangelistic efforts. Of course not. It simply emphasizes the importance of following Jesus' example. So I want to end by telling you a story. And I may have told it here before, just laugh at the right places. When I go on vacation, in fact, my wife won't even go on vacation with me unless it's at least 10 days. Because she says the first 3 days I'm unwinding and getting stuff out of my system, work-related, and the last 3 I'm already getting geared up for what I know is waiting for me when I get back. So it's that time in the middle that she says is truly vacation, and she has me. If it's a weekend, she goes, yeah, forget it's not worth it. Forget it. And I'm a workaholic, but when I'm on vacation, I mean, I'm on vacation. I mean, you know, and when you're a pastor, two things happen. People either tell you their life story, or they go, oof. One time I was buying a car, and that's an interesting experience. You ever bought a car, you know the different, the first guy that meets you in the parking lot is that happy person that the car's almost free. Today's your lucky day. Well, this individual was smoking and using horrible language from the get-go. Horrible, just so it tells you how long ago this was. And I was kind of smiling inside because I knew he was going to ask me what I did for a living. So I'm just waiting. He's like smoking and cursing. Finally he goes, what do you do for a living? I said, I'm a pastor for the Seventh-day Adventist Church. I believe in God. Reverend, this car would be great for ministry. I mean, come on. Right? Come on. The story is told of a pastor that was on vacation in Georgia, from Georgia to Tennessee. And they were at a resort. And as he's there with his wife, enjoying personal time, because, pastors, and Pastor Vitale, and I know this for a fact, and others, I mean, we get, you're never off the clock. Issues are all the time, and that's our role. I love being a pastor, but it's when you're on the clock, you're on the clock. Whatever happens, whenever it happens, you need to be available. So on vacation, the pastor just get away, don't talk, just he and his wife, and he sees this old man walk in with that look. And so he looks down, and he tells his wife, don't make eye contact with the guy at the door. What? Just look down. And the old man's looking around, and he starts making his way, and wouldn't you know it, of course, he goes right to their table. And now the pastor's angry and he's mad, and the wife's kneeing him under the table, behave yourself. And the questions start that inevitably lead to, what do you do for a living? He says, you on vacation? The pastor, well, we're at a resort. No, be nice. Where are you from? Georgia, really? What do you do there? Sure enough, I'm a pastor. Really? Let me tell you my story. Oh, here we go. And he sits down. He just sits down. And the pastor's livid, angry. This guy's ruining his trip. Forget the meal. The whole trip is ruined. And he starts talking. When I was a kid, I was terrible. I mean, I was mean. I was evil. And that was the right word, evil. People would they would cross the street to get away from me. And they should, because I was bad. But you know what? I liked the pastor of the local church. For whatever reason, I just liked, but I was smart. I would come late and leave early. No one ever talked to me. One day he said the sermon was so good, and I was stuck that the pastor got to the door before I did. And he was like Pastor Vitale, strong, good looking. And I tried to get up, and he grabbed me. Oh, not so fast. And he said, I knew what was coming, and I knew I deserved it. The verbal lashing. You don't think I see you in the city? Shame on you. You don't think I know who you are? What are you doing? Shame on you. I was waiting for it, and I deserved it. But Pastor, I want to tell you something. What he told me that day changed my life forever. Really? What did he say? You see, because the one thing we like more than being interrupted is a good sermon illustration. What did he say? Oh, boy, I'll never forget that day. Oof, it was hot. Yeah, okay, what did he say? And he put both his hands on my shoulder. Yeah, okay, but what did he say? And he looked right at me. What did he say? Finally, he goes, okay. He grabbed me. He put his hands on my shoulders. He looked me straight in the eyes. And then he said this, young man, you're a child of God. And when I look at you, I can see the resemblance to your heavenly Father. Now go and live in the joy of your inheritance. And he let me go. Changed my life forever. Well, enjoy your vacation. Thanks for listening. He got up and he just started walking away. And the pastor's like, and he says, "Sir, what's your name?" True story. The old man turned around and said, "Hooper," and walked out. And was recognized as the former governor of Tennessee, who some to this day consider one of the best governors the state has ever had. Church family, I want to tell you something today as I end. You are a child of God. And as people look at you, they can see the resemblance. But here's the great news. Everybody in our community is a child of God, just like we are. And we need to pray that God will give us the ability to see people the way He sees them, to genuinely desire their good. Tell your story. Let's get this done so Jesus can come and we can go home. God bless.
We have heard some powerful, powerful sessions today, and I am glad that I'm here. I'm glad that you're here, and I'm standing up here instead of on the floor like I did before because as much as I like to think that I'm a young man, my memory is not what it used to be, so I have my notes here. So as we do some things before, I want to make a couple of announcements, and then we'll have lunch. So give us about a few more minutes, and we'll have you out for lunch at 1:30, like it says on your little itinerary. So number one, if you have children still with the children's program, please pick up your children before lunch. It should be the 6-year-olds and under. So if you have children with in the back, please pick them up before lunch. The second thing I'd like for you to do is on your lanyard here, there should be a QR code for a feedback survey. If you don't have that lanyard, it's this QR code that's right behind me as well. We would like to get some feedback as to how we can improve, things that we can change for next year as well. So if you miss it up here, it should be, if you have a lanyard, it should be in the bottom right-hand corner, I believe. All right, I want to invite up a few people at this time. I'd like to invite the people who are giving their sessions tomorrow. So come on up, please, Dr. Ben, real fast, and Pastor Jafia, come real fast. We're going to kind of prep for tomorrow. Then we're going to invite some other people up too as well. Yes, you're giving ours as well. Thank you very much. And we're going to give you a quick preview. See, many times people will come on Sabbath or on Saturdays to our sessions, and they're like, "Oh, that was such a great day," and then they forget that we also have some things planned for Sunday as well. So actually, Mr. Nassim, can you come up, please, as well? So after lunch, I know a lot of people are like, "Oh, I'm tired, I want to go home," and we have some great sessions still planned. So we want you to stick around and stay, please. And so we're going to start with our afternoon session. So he's going to tell you quickly kind of what it's about and encourage you to come back.
Absolutely. So we've heard all the risks that happened with disconnection, right? And hopefully you've gotten the idea of why social connection is necessary. But there's a struggle. And so that transition from knowledge into practical applications. I'm a licensed professional counselor, and sometimes there are our thoughts, our emotions, there are other things that get in the way of connection, and I'll be speaking about those this afternoon.
Thank you so very much, all right? And then in the morning as well, before we get started, we're actually going to do a 5K, all right? We're going to do a 5K, and there's a couple of things that I would like to remind you if you're going to participate in our 5K. It's going to be at 8 o'clock. Give me 1 second. I got to pull up my notes here again. All right, sorry. The race is at 7:30 a.m., All right, and it's going to be at which park? I forget. Nanny Falcone. Nanny Falcone is literally, if you drive 4 minutes down the road, that's where it's going to be. Bring water, bring bug spray, and plan to arrive a little early for a warm-up, okay? We have a trainer that will be there that will kind of walk us through some stretches, things like that. So you can come, they do the 5K. And the cool thing about it is many of our doctors participate in the 5K. And so they'll walk, some will run, and so if you see them there, you just want to talk to them about different things, they are more than willing to talk to you while the 5K is going on. So that's one of the cool things. You won't get that any place else. Usually people charge for these particular things. With that being said, afterwards, we come back here to the church, and then we have breakout sessions. And so I'm going to start with kind of what we're doing at the breakout sessions as well. Each one is about 30 minutes, I believe, and then you rotate. So you don't have to pick and choose. We do a rotation, and we still have you out by 1 o'clock. And so our first, session number 1 here, Dr. Stephen Ralph and Chef Ramona Lezo.
Thank you. Chef, are you here? Chef Ramona? No. So tomorrow morning, I'm Steve Ralph. I'm an internist and lifestyle medicine specialist from Killeen. I lead out with health ministries for the Killeen Church and also for the Texas Conference of Seventh-day Adventists. So I'd like to mention something briefly in a moment. But for tomorrow morning, we're going to be talking about nutrition. And when we do Diabetes Undone program in Killeen, we really emphasize the hands-on approach, because I can explain to you about what to eat and so forth, but if you get into the kitchen and you don't know where to start, what good is it? So we try to give some hands-on to make it more practical and realistic. So we're going to be actually piggybacking 2 30-minute periods into one. That'll be 1 hour, and then we'll be repeating it again. So if you miss it one time, there'll be another session. So that's going to be focusing on brain health, or what we call nutritional psychiatry. And the cooking part, I guess we call culinary coaching. So that's sort of what we'll be doing tomorrow. Now, from the Texas Conference point of view for health ministries, there may be people here that want to try to start a health ministries program in your church. So in about a month, I believe, in this very location, we're going to be together as one program from the Texas Conference, and I'm going to be sharing how to get started leading out a health ministries program. So if you're interested in that, there'll be a handout, a manual that we'll be giving you. And if you register, lunch is included, I understand. And so I look forward. And I'll be in the vestibule out in front of the exhibition. I'll be at a table. So if you're interested at all, please feel free to come over and ask any questions. Thank you.
All right, thank you so very much. Our next session as well, Dr. Ben, tell us what we're talking about tomorrow, please.
So after our 5K, I think we've been doing this every year, the past 3 years. We'll be sharing some practical experiences. We theme this Healthy Together. So how are we going to leave out some of the things that we've talked about? What are some of the strategies? A lot of times, most people have shown up, and then we've shared some very wonderful ideas as to how to even start their own individual health plan. This time around, we want to transition into having the group fitness programs and everything. So how do you even want to even start even as a family? What are some of the things that you can engage in? Some of the practical ways that we can actually be very active and fit. Very simple things. How do I even get to be active if I don't have gym membership? How can I do that? I think that we've done that, and then tomorrow, God willing, we are going to do that. So it's going to be hands-on, so get your yoga pants, your sports pants, and everything that you have, and we're going to be here after the 5K to have live, hands-on experience how to get it done.
Thank you so very much. Now, the next session says it's by Pastor Vitale, but Pastor Vitale will be driving or in Keene tomorrow, so our other pastor, Pastor Jafia Reeves, will be taking over. What are we talking about tomorrow, Pastor?
Yeah, so we have been talking a lot about how connection affects our health, and tomorrow we're going to be looking at how connection affects our spiritual health, why it's also important to gather together for our spiritual health. Maybe it's like, oh, of course, it's obvious we come to church, but I think even beyond that, there's a benefit for our well-being, our spiritual well-being, by engaging with each other. So we're going to talk through what that looks like, what the Bible has to say about that, but also like they're saying, how do we practically live that out with one another?
Thank you so very much. And session 4 will be by a video with Nancy Phillips, but she's not here. Obviously, she'll be by video. But our 5th session will be by John Comey. Tell us what we're going to talk about tomorrow.
All right, so tomorrow we're going to talk about social media and how we can be able to use it in a moderation form. So we're going to learn about practical ways to use social media and be able to connect with people in our society. So most often we have Facebook and other social media that we have a lot of followers. So if I have a question, how many followers do you have on Facebook? Most of you will be like 100, 500. But how many of them can you communicate, or can you call them at night if you need some help? So we're going to talk about how to be able to use social media in moderation and practical ways to be able to connect with each other when we come to church, in our community, be able to connect with each other and build good relationship whilst we use social media as well too.
Thank you guys so much. Please do not leave. I want to ask Dr. Schwartz to come up and Dr. Ochiri to come up, please, as well as Pastor Vitali. We have a few more announcements. We're clicking good on time here. But as they come up, before they make that particular announcement, I'm going to ask Eileen Perkypile to please come up as well. So doctors, just hang out for just a second, and then we'll get right to you.
Hello, everybody. I was about to say good morning, but we're in the afternoon. I'll try to make this as short as possible. My name is Eileen. I'm a mom of 3 kiddos. I go to church here, and I also am a volunteer on the board of Scenic Hills Christian Academy. For those who are new to our church community here, if you just walk out of the sanctuary, turn right, exit through those doors, and look up the hill, there's a building there. That's Scenic Hills Christian Academy. We are a pre-K 3 through 12th grade private school here in San Antonio, fully accredited, lots of great academics and everything. But I want to share a little bit about that because we're not just an educational institution. I grew up in public school. I loved my public school experience, so this is in no way a fault to public school. Today, I just want to talk about how our school specifically is more than an educational institution. We truly are a community. The families that send their kiddos at our school, we share values. There's a lot of things that bring us together. For those of you who do not know, businesses, those who are aiming to be successful, one of the top things that determine the success of an organization is the team, the staff. Our educators, the employees at our academy here, they're not just teachers, they really are answering a life calling. Many of them, in addition to teaching on a day-to-day basis on the weekend, they volunteer here. Some of them checked you in today. Some of them are taking your picture now. Some of them are organizing the 5K for tomorrow. Some of them serve as spiritual leaders of our church. Really, our educators, I would say, are the core of what make our community so special. Our community is also made up of homeschool families, not students that are there day to day, but families who contribute and have shared values with us. And then our church community here. We are an extension of our church, and we really do a lot of things together, not just activities, but we share a vision for the kiddos that attend our school. Some of our students are here in our sanctuary today, and they're exceptional leaders. You've seen them up on stage before. And so I just wanted to extend an invitation. If you have kids that are pre-K 3 through 12th grade, or you have a neighbor or a relative that is looking for not just what school should my child attend, but really, I want to belong to a community. I want my child to really feel connected with their friendships. I want to be part of a group of parents that has not just academic goals for their kiddos, but really lifetime goals for them. Choose us, Scenic Hills Christian Academy. Our enrollment is open right now. Early enrollment, which comes with a discount, ends on Thursday, so this coming week. Please consider us. There are 2 flyers in the lobby that I encourage you to look at if you want additional information. Again, you might be a retiree or an adult couple with grown kids, but you know of somebody that might benefit from attending our academy. This flyer here that's in the lobby has all the information on enrollment, including tuition costs. And then there's an additional one, and it's about our annual event. It's our biggest event of the year, and it's just a great way to support our academy. We have a lot of church members that show up and really support us. It's a golf and gala benefit on May 17th. So if you want more information, we encourage you to go by the lobby and grab this. And again, a lot of our educators and volunteers are here in the audience. If you just ask somebody, they'll point you in the right direction. Thank you so much.
Pastor Vitale, please. Thank you so much, Eileen. Appreciate it. Pastor Vitale is going to make an announcement, and then we have one other thing, and then we're going to break for lunch.
So we are grateful for opportunity to be here together, and we want to take this time to highlight our speakers and to express to them a small token of our appreciation. So, AJ, if you don't mind, we have a little gift that we prepared for everyone. We know that we cannot fully compensate you for your time and expertise that you're sharing with us, but we're hoping that this will be a small memento of the time that you spent with us, and gratitude for willingness to dedicate yourself and your talents. Grab it for Pastor as well, yes. You deserve one too, Pastor. We love you. And make your announcement, and then I'm going to have a prayer for lunch as well as a prayer of gratitude for our speakers.
Okay, again, we do have lunch. It's free. Our workers have eaten already, and they tell me it's delicious. If you go out right across, you're going to just go out these doors and keep walking straight. That's where lunch will be served. There are tables in there. If those get full, there's a door outside of that. We call it the fellowship hall, but outside of that room, there's a door. There's a nice lawn area. We have picnic tables out there. And then also in this section over here, there are other picnic tables. So there are 3 different sections where you can eat your lunch. We do not want you to leave, because when we finish lunch, shortly thereafter, we're going to come back. We're going to have our Q&A with the doctors. Actually, no, I think there's a session first, and then the Q&A with the doctors. Lots of great information still to come.
AJ, do you know what's on the menu?
Is it, Chipotle bowls, I think, is what's on the menu.
Burrito bowls. Yes.
Burrito bowls or something like that. Yes, Chipotle or something, except better.
But fitting with the Blue Zone diet as well. All right, let's bow our heads together. Father in heaven, thank you. Thank you for giving us opportunity to be together, to know you as our Savior, but also to grow and to understand not only a spiritual or social makeup, but grow physically. And I pray that today you would open our minds and help us to retain the information, but then give us courage and willingness to implement it in our lives. Father, in a special way, I thank you for all of these men and sisters who are involved in creating this program and sharing with us what you had taught them, what you have impressed on them. Bless them, bless their families, bless their lives, professional, personal, and spiritual. May we all, Lord, as we come to heaven, recognize that this was one of the moments when we had opportunity to start our life again, to make better choices, and to glorify you for teaching us. In your name we pray. Father, I also thank you for all the hands that prepared our lunch. Nourish our bodies to your honor and glory. In Jesus' name, amen. Amen. Thank you. So you're welcome to go to the fellowship hall, start lining up, and enjoy your lunch. AJ, get in the picture.